testimony that we had showed otherwise.
Okay, well.
Will the Senate please come to order? That's you, Miss Clarkson. Come to order. We will observe a moment of silence in lieu of a devotional. Thank you. Will you please rise and join me in the Pledge of Allegiance? I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Are there any announcements? Senator from Windsor.
Thank you, Mr. President. I believe this is the moment that I'm supposed to do this. Oh, how exciting. After all these years, I actually have the right moment. I would like to move that the rules be suspended and pending entry onto the notice calendar that H775, an act relating to tools for housing production, be committed to the committee, the Senate Committee on Natural Resources and Energy, with the report of the Committee on Senate Economic Development, Housing, and General Affairs intact.
The senator from Windsor has moved that pending entry to the notice calendar H775 be committed to the Committee on Natural Resources and Energy with the report intact. Are you ready for the question? If so, all in favor say aye.
Aye.
All opposed, nay. The ayes have it and the motion carries.
Mr. President,
Senator from Chittenden.
could I ask for a brief recess and that the bell be rung for senators to come to the floor?
We will take a brief recess. Will the Senate please come to order? Senator from Chittenden.
Thank you, Mr. President. I would ask all senators to regard the times for floor as inviolable. So coming in 20 minutes after we start, at this point in the session, no longer acceptable. Everyone needs to be here. We are divided by very thin margins. So my office can't be trying to run around and find senators. So please, if you have to leave the floor for some reason, there are moments during the presentations when it's clear that we're going to be on a bill for a certain amount of time. But when we come to the floor and we're moving bills, we're doing other things, best if everyone is here from the get-go. Thank you, Mr. President.
Are there any further announcements? Senator from Bennington.
Mr. President, I ask that the House Committee, the Senate Committee on Education be relieved of H955 and that the same be sent to the Committee on Finance.
Senator from Bennington has moved that the Senate Education Committee be relieved of H955 and it be committed to the Committee on Finance. Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay.
Nay.
The ayes appear to have it. The ayes do have it. Motion carries. Are there any further announcements? We have 9 appointments which we have received from the governor and which are now being referred to the committees having jurisdiction. These appointments will appear in today's journal, which you will receive tomorrow. H 727, being on the calendar for notice and affecting the revenues of the state under Rule 31, is referred to the Committee on Finance. H 757, being on the calendar for notice and carrying an appropriation under Rule 31, is referred to the Committee on Appropriations. 757. Oh, okay. Yep, let's start over on that one. H 757, being on the calendar and affecting the revenue of the state under Rule 31, is referred to the Committee on Finance. H 915, being on the calendar for notice and affecting the revenues of the state under Rule 31, is referred to the Committee on Finance. And H 928, being on the calendar for notice and affecting the revenues of the state under Rule 31, is referred to Finance. Someone sat on their key. H 578, being on the calendar for notice and carrying an appropriation under Rule 31, is referred to the Committee on Appropriations. H 740, being on the calendar for action and carrying an appropriation under Rule 31, is referred to the Committee on Appropriations. H 817, being on the calendar for notice and carrying an appropriation under Rule 31, is referred to the Committee on Appropriations. Sounds like quite a harmony out there.
Oh, it is.
Everybody press their button.
Yes.
We have a joint resolution to take up at this time, JRS 53, joint resolution relating to weekend adjournment on May 15th of 2026, offered by Senator Baruth of Chittenden Central. Listen to the reading of the resolution.
Resolved by the Senate and House of Representatives that when the two houses adjourn on Friday, May 15, 2026, it be to meet again no later than Tuesday, May 19, 2026.
Now you've heard the reading of the resolution. The question is, shall the Senate adopt the resolution on its part? Are you ready for the question? If so, all in favor, say aye. Aye. All opposed, nay. Ayes have it, and we've adopted the resolution. We now have H 953, an act relating to approval of the amendments of the Town of Panton, introduced by Representative Byrong of Vergennes. It passed the House on May 6 of 2026. Listen to the first reading of the bill.
H 953, an act relating to approval of an amendment to the Charter of the Town of Panton.
Now the bill's been read a first time and failing to meet the crossover deadline per temporary Senate Rule 44A is referred to the Committee on Rules. Should we take a brief recess and try to figure out whose car's going off?
Might not be a bad idea.
We'll take a brief recess.
Okay.
No.
Will the Senate please come to order? I believe we've reached the orders of the day. Oh, is that the third reading, John? We have H 944 for third reading. Are there any amendments prior to third reading? We have H 944 for third reading. Are there any amendments prior to third reading? Seeing none, listen to the third reading.
H 944, an act relating to the fiscal year 2027 transportation program and miscellaneous changes to laws related to transportation.
The question is, shall the bill pass in concurrence with proposal of amendment? Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay.
No.
The ayes appear to have it. The ayes do have it, and we've passed H 944 in concurrence with proposal of amendment. Top, yep. Okay. We have S 179. It was passed by the House with proposal of amendment. The question is, shall the Senate concur in the House proposal of amendment? Senator from Chittenden North.
Thank you, Mr. President. S-179, senators might remember, maybe a month and a half ago now, is about the disclaimer of property. And that is when something is left to you, you can disclaim it, I don't want it, and it moves along in the process. The House Judiciary Committee had a very eagle eye on our language and found one word that we forgot to include in our work in Senate Judiciary, and you can find that at the top of 2615 of today's calendar. This is when a parent is disclaiming property on behalf of their minor. We left out the word child, so it's disclaiming property on behalf of their minor child. That is all that this amendment is doing. It's adding the word child after minor. So on a vote of 5-0, straw poll of 5-0 in the Senate Judiciary, we ask for the Senate support. Thank you.
The question is, shall the Senate concur in the House proposal of amendment? Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay. The ayes have it, and we have concurred with the House proposal of amendment. Okay. 79. Are we passing over 230? Okay. We have on the calendar for action H 660, which passed the House. Senator from Chittenden.
I'm just wondering where H 660 is coming.
H 660 is,
If I might just ask for a very brief.
we'll take a brief recess. Will the Senate please come to order? We are passing over several bills, which brings us to H 660. We have on the calendar for action H 660, which was passed by the House on May 1st of 2026. Was referred to the Committee on Health and Welfare, which reports it has considered the bill and recommends that the Senate propose to the House that the bill be amended as it appears starting on page 2627 of today's calendar, and that with such proposal of amendment, the bill ought to pass. Affecting the appropriations of the state, the bill was referred to the Committee on Appropriations, which recommends that the bill ought to pass in concurrence with proposal of amendment as recommended by the Committee on Health and Welfare, with further proposal of amendment as found in your calendar on page 2633. Listen to the second reading of the bill.
H 660, an act relating to fiscal year 2027 opioid abatement special fund appropriations.
Recognize the senator from Chittenden Southeast, Senator Lyons, for the report of the Committee on Health and Welfare.
Thank you, Mr. President. As you may recall, the state benefits from a settlement fund with some of the pharmaceutical industry regarding to opioid addiction and the liability of those companies. So the state each year receives funding as a result of the agreement, the settlement. Vermont has benefited for several years for a fund called the Opioid Abatement Special Fund. And we also, as we learned about this fund a few years ago, we put in place an advisory committee working with the Department of Health to make recommendations about how to utilize that money. Understood that there's a guidance document that comes to us with the settlement. So H660 is another opportunity to utilize opioid abatement special funds to reduce the addiction and improve the outcomes for folks with addiction, reduce harm, have harm reduction in the state, to establish programs to help people who are addicted to opiates. The advisory committee this year, they testified in our committee, and this year they have set up quite an effective system for evaluating requests for the use of the monies that the state receives in the special fund. I believe they reviewed 67 different applications this year. And as we heard from the reporter from the House, they meet, they review, they meet again, they decide, they make recommendations to the Department of Health. The Department of Health might also have its own separate recommendations. So we received a memo both from the advisory committee as well as from the Department of Health regarding the use of the special opioid abatement special fund. It's very complicated, and it's complicated simply because as we have made progress in our work on recovery centers and offering support for those with opioid addiction, we've developed new programs, and we've developed projects across the state. So as recommendations are made, then that needs to be integrated in with what is happening in our committees in the legislature. So overall, what this bill does, it appropriates money from the opioid abatement fund, and I'm happy to give you details about the fund. So in January or February of this year, there was $11.8 million in the fund, and then with the appropriations and allocations included in this bill, that has been reduced. We have spent we have spent $6,710,000 with the appropriations that are included in this bill. And then the bill also includes some reversions or money that's come back to the fund from projects that have been completed or nearly completed and haven't needed the rest of the funding. So as you look at the bill, I'll give you a brief overview and then we can go through it section by section. Within the bill, there are appropriations for existing ongoing projects, and those projects are in section 1 with some subsections subsections of Section 1, and they're in subsections 1A, 2A, 3A, 4, and 5. And those appropriations include outreach case management positions, they include recovery residences, they include syringe services, they include peer recovery center coaches in correctional facilities and probation and parole officers. They include support recovery programs at emergency shelters. So that's the existing ongoing project. So they're projects that have previously been funded and now have received additional funding to continue their work. Then there's also proposed new funding in subsections 6A, 6B, 7, 8, 9, 10, 11, and 12A, the subsections of Section 1, where all the appropriations are for the opioid abatement special fund. And those new funding proposals were new recovery beds at level 3 or higher for recovery residences, and opioid use disorder residential treatment beds at the American Society of Addiction Medicine at a level 3.1. And there's a difference between what we call the NAR, the National Alliance Recovery Residents, and the American Society of Addiction Medicine for those different levels. There's also money in this section of the bill for pre-hospital Vermont emergency medicine buprenorphine treatment prevent program to expand training for emergency service providers in carrying and administering buprenorphine. It's a very important program. The other section 8, subsection 8 includes subsidy for room and board in the Rutland Mental Health Services Transitional Housing Program, money for the Springfield Project Action to support public safety enhancement team coordinator positions in various towns, cities across the state. Section 10, recovery center appropriations. Section 11, expanding public safety enhancement teams, harm reduction and strategic community intervention. And 12A, grants to the city of Burlington for their overdose prevention center, which is an ongoing project. And so we're continuing that funding. There are also reversions in the bill that I mentioned earlier that come from programs like that were enacted previously in 2023 and 2024. So there's money that's come back to the state as a result and into the opioid abatement fund. So that's kind of the highlight overview of the bill. And I will go through the bill briefly with you, and I'm happy to respond to questions afterwards. So as it passed out of the Senate Health and Welfare Committee, we looked at Section 1A. We realized that there is carry forward money in Section 1A for the preferred provider network. They needed $1.96 million. They did have some money, so we put in place $455,000 to make that program go forward. In Section B, the intent, we also have put intent in the bill about which programs would be supported by the opioid abatement fund going forward. So our intent to continue the support of some of these programs until and unless there's insufficient funding. Section 2A is the Department of Health for recovery residences and the Vermont Alliance of Recovery Residences. Now, as we go through the bill, some of the recommendations that are in here resonate and are consistent with what the opioid the OSAC, Opioids Special Fund Committee, Advisory Committee recommended, and then Department of Health has recommended. And so, for example, in this case, the OSAC, the Advisory Committee, recommended $1.75 million, and the Department of Health recommended 1.4. and the House recommended 1.6. So some of these numbers are compromise numbers, some that we agree with the House, and some that we have put in place. I won't give you all of the details on each of those, but I wanted you to know that there were some changes made as the funding was debated, both in the process with the advisory committee, the Department of Health, and then the committees of jurisdiction. Then section 3A, subsection 3A of section 1. Again, this is for the syringe services program, the HIV program, which is a very robust program with mobile delivery, with counseling, and with help for folks who originally started to prevent HIV and have clean syringes in place. And this is funded through the opioid abatement fund. Subsection 4 is to the Department of Corrections to provide peer recovery center coaches in Vermont correctional facilities and in probation and parole offices to provide group and individual coaching, reentry support, so on. This is, think about how important this is to get people on the right track and transition out of corrections. Subsection 5, Department of Children and Families, Office of Economic Opportunity, in support of long-term programs at shelters for individuals experiencing homelessness, including harm reduction supports and transportation to recovery meetings and appointments. So adding in an opportunity for people to meet, to get to their appointments for counseling or clinical treatment. Subsection 6A, $600,000 to the Department of Health for the creation of new recovery residence beds, and this is the level 3 or above for National Alliance of Recovery Residences. These type of residences provide for peer support and perhaps some additional counseling. They are not intense clinical, it's not an intense clinical environment, but it is rather support services for folks with opioid addiction. There's also a section B of 6B, $600,000 for the use of, for opioid use disorder residential treatment beds at American Society of Addiction Medicine level 3.1. This means that these folks are eligible to receive medical treatment and that receive prescription drugs, for example, that will help them in the recovery process. So there's clinical treatment included in that level of treatment facility. Subsection 7, this is the Department of Health Prevent Program, giving training to our EMS folks on the use of buprenorphine to stabilize and help people when they, after they've been administered naloxone. Subsection 8 is $35,000 to the Department of Health to subsidize room and board at the Rutland Mental Health Services Transitional Housing Program. And this is a case, in this particular case, as well as in subsection 7, subsection 8, and subsection 9 that we look at next, there was full agreement between the OSAC, the Advisory Committee, the Department of Health, and the House and the Senate. So subsection 9 is money for distribution to the Springfield Project Action to support public safety enhancement teamwork coordinator positions in a number of cities across Vermont. Subsection 10, we added this in the Senate Health and Welfare, $800,000 for distribution to recovery centers for improving peer support services. Places like the Turning Point Center where people go in for daytime support, learn about employment opportunities, and can return into their a home and a town environment, community environment. Subsection 11, money give $287,000 to the Department of Public Safety for the public safety enhancement team's harm reduction community intervention work. This is a local work to help people in difficulty with opioid addiction. Subsection 12A, $1.1 million to the city of Burlington. This is an ongoing commitment to the city of Burlington. It began a couple of years ago. There's a huge discussion about whether or not to commit this money since the previous appropriation has not yet been spent. And what we understand is that if this money is not utilized, then it will revert. But in the meantime, we need to have a cost accounting of what has been put into our legislation. So that's that one. And then section 14 is, this section 14 is really a technical correction so to take out specificity and to allow for redistribution of funds that were appropriated in 2023. So to allow for, and instead of identifying a specific clinical location, to allow for a satellite location in northwestern Vermont. Then there's language about the, that's the appropriation through the opioid settlement fund. Then there is language directing the advisory committee to establish do some thinking about the work that they've been doing. They've been doing an amazing amount of work and a good job, and to look at funding proposals and how those funding proposals might be sustainable. So asking for the advisory committee to look at those ongoing funded projects and ask for a sustainability plan to help move things along and to know when they need funds, when the funds should be stopped. And one of the reasons for this is that the opioid settlement is not ongoing forever. It can be over encumbered very quickly. In fact, if you look at the fund out to 2020, 2035, we can see that it will be overexpended by over $1 million. So to look at how to utilize the funds effectively over time is an important role for both the advisory committee and the Department of Health. Then in section 4 of the bill, we've asked for a hiatus in new appropriations and to continue to look at the annual funding that we have for those ongoing projects, as I said earlier, but then also to take some time out and to understand what do we need to do in the future. If funds are available, how do we use these funds going forward? To do some thinking about the best use of that settlement. Also knowing that we're going to see more money coming into the state from other settlements. So this would be an opportunity to measure the best use over time. And the advisory committee, along with the Department of Health, is a good place to do this. Section 5 are reports that would come in to us, quarterly reports from the Department of Health about how the money is being distributed and appropriated. We did hear from some folks that while the money had been put into our appropriation in this building, that the money hadn't actually reached its destination. So we wanted to get a report back about that money. Where is it going? How is it being utilized, if it's being utilized? We heard from at least one organization that they had not received the money that they had been promised and still hadn't gotten it this year. Then there's a section 6 on reversions, and you can see the amount of money that comes back from the different groups that are there. That's money that was not used, but is now back into the fund and will be available for future projects. Section 7, one of the discussions that we had, and that both the House and the Senate had, our committees of jurisdiction, was the proper use of the opioid settlement fund dollars as compared with the substance misuse prevention special fund. We know that special fund comes from the excise tax for cannabis. And so that has a very specific definition of how it's utilized. The money for the opioid special fund also has its own little definition. And the guidance from the settlement papers clearly indicate, at least from our perspective and from what we heard from the AG's office, is that that money in the opioid settlement fund belongs for opioid prevention. The substance misuse prevention fund is a little broader. It goes to nicotine, tobacco, healthy lifestyle, all those things that we think of when we think about youth prevention, for example. So there were some projects proposed that came to us from the advisory committee and Department of Health that wanted to dip into the substance misuse prevention fund. And we wanted to really define the difference between these two funds and make sure that projects that were being used, were being funded from the appropriate place. So Section 7 is really looks at some projects that were included in the bill as it came over to us from the House, and actually, I think with agreement from that committee to include money for the Elevate Youth Services, the Greater Falls Connections to enhance youth engagement, distribution to the Friends for Change to increase access to community-based therapy, housing, crisis, medical recovery, and so on for youth in Windham County, and then for the Winooski Partnership. Those four we felt were best placed, funded through the Substance Misuse Prevention Fund. So it's a delicate balance, and then going forward, we're going to have to really evaluate each of these funds and how they're utilized. And then the Section 8 is, looks at the budget presentation from the department to our talking about how the fund is going to be used for the coming year. And then the bill takes effect on July 1st. We heard from Rep. McGuire, sponsor of the bill, who's also on the advisory committee. I did talk with our member of the advisory committee as well. We heard from Joint Fiscal. We heard from the Department of Health. We heard from various advocates. We heard from Department of Health a couple of times, several different people. And then we heard from Action Circle. We heard from Ledge Council. We heard from the National Association of Recovery Residents, and we heard from Recovery Residences of Vermont. So a number of folks weighed in on the bill with us. That's the report from Senate Health and Welfare, Mr. President.
If you would like to stand and not sit back down, I understand you're also the reporter for appropriations.
I am, Mr. President, and as appropriations looked at this bill and the question about how the opioid settlement fund is used, the Senate Committee on Appropriations approved of the appropriations that were there, thought that had done a good job given all the work that the advisory committee, Department of Health, House Human Services, and our committee had done. But we did make some recommendations in the first instance of amendment, adding some language that each ongoing funding proposal considered by the advisory committee shall include a sustainability plan that's consistent with the bill that we had passed out of our committee. And then there were other recommendations made by the committee, and that was to ensure that when the opioid abatement special fund is utilized, there be some consultation or with the Office of the Attorney General, both by the Advisory Committee and by the Department of Health, simply because the guidance documents are those that are held in the Attorney General's office, and they're responsible for ensuring the legality of the work that we do with respect to that fund. Then there's a final amendment on the, at the end, was a correction, a request that we put in the last sentence, that when we're talking about harm reduction services, co-occurring mental health conditions and co-occurring substance use disorders. So the co-occurring piece being important, it wasn't included in the underlying language. So the Appropriations Committee voted, I think it was 7-0-0. The Healthcare Committee voted 5-0-0. And we ask for your support of the bill and the amendment. Thank you, Mr. President.
Senator from Orleans.
I believe the amendment vote was 6-1.
Oh, 6-1.
Are you ready for the question? Senator from Essex.
Thank you, Mr. President. There's probably nothing that I'm more passionate about silently, other than in my actions, than drug addiction. I've probably done silently. I don't wish to publicize it. It's my battle that I do. I probably have dropped off and picked up more people at recovery houses than anybody combined in this room. I have worked hard to get mental health areas into my community. I have worked hard to get sober living places into my community, because I do believe that we owe it, that every community ought to take care of their own, and that's what I do. When I was in high school, the bus used to take a circular route, and I used to jump off about 2.5 miles from my home because I just didn't want to go on down that bumpy road and take that bus ride, and I'd walk home. I used to play the game of, as I walked down through, count cigarette butts. How many steps could I take to count cigarette butts? And it was pretty phenomenal how, at that time in my life, about how many people smoked and how many cigarette butts that I would count. We don't do that anymore. People don't smoke, but we count needles now. We count needles as we walk down through, and orange caps and all of that. I think I'd rather count cigarette butts than dirty needles side the road waiting to cause harm. And I can't imagine in today's world that we would be funding anything to support illegal drugs, legal nowhere in the world. But we want to fund a drug house so that people can go there and use drugs illegally under the guise of harm reduction. Well, I've got an ex-wife that lives in a harm reduction place. It's called a drug hotel. She's there. She's been an addict for a long time, and that's what's caused our divorce. But worse than that, I've got a stepson that would be 43 this Friday, who chose to hang himself other than keep on doing the harm reduction type of drug work that's being proposed in this bill. And that was a little bit less than 6 months ago. There's a lot of good in this bill, but there's about $2 million worth of monies that shouldn't go anywhere other than go to help people to get off of opioids or whatever drug that they're addicted to. We don't go to AA and just have a little small drink and share it around and tip up and say that it's all good. We don't go anywhere to have just a little bit. You don't quit smoking by taking a puff here and a puff there. You don't quit anything that you're addicted to by just having a little bit more and then calling it great. You just don't do that. If you want to quit, you quit. I get it that addiction's hard, addiction's tough, and everybody suffers in their own way with it. But nothing is cured until you stop using drugs, alcohol, or whatever you're addicted to. There are already places where being proposed in this bill to keep on funding something that is just a hellhole. You look at the videos around the world where it's worked nowhere successfully. Yes, I know that there are places that have them, but you see the videos online about these people laying around and all drugged out, and just, they might as well be dead because they are dead and they don't even know it. Well, we have those places already. We have them called the drug hotels. We have drug houses. We used to have opioid dens and all of that. I'll be doing an amendment before third reading on this bill to strip out these dollars to keep on causing harm to our people in Vermont. We lost 170 people last year on because of opioid addiction. That's down, which is nice. It is. I'm thankful that it is down. Thank God for Narcan, because we probably would be 5, 6, 8, 10. Who knows how much higher we would be if we didn't have that drug. But there is no way at all that anyone in this building should be supporting furthering people's addictions by putting monies into it to just help them along. Could I ask a few questions of the presenter of the bill, please?
The presenter of the bill is interrogated.
Mr. President, we've already given $2.2 million to a certain place in a certain community. How much of the monies that the legislature has given does this, whoever's holding those dollars, how much of those monies are still available?
I'm trying to understand the community that you're talking about. So if you could.
There's a community, I think it's going to happen in Burlington. I'm not sure, but there's a place where they're thinking about having a place where people can go use illegal drugs. And I think we have given up to $2.2 million, I believe, pretty close to that, but I could be wrong, and I wouldn't stand to be corrected. But I would just be curious about how much of those dollars are still available to the people that are trying to set up such a program.
Thank you, Mr. President. So the Overdose Protection Center that is to be developed in the city of Burlington has already expended about $400,000. So there's $700,000 left. Once the venue is established, and they begin to fit up their programs, which include clinical and treatment, counseling, and other things besides allowing for site use of specific drugs. Once that happens, they'll need the full appropriation that was passed a few years ago.
Mr. President, I've read just recently in the paper that the site that they're proposing wouldn't have any clinical people, that they couldn't afford to have anybody in there to have any of those types of services. Am I misinformed with the reporting, Mr. President, of what I read in the paper?
I don't understand what you have read in the paper or which paper. I do know that when we debated this issue and passed it as a separate bill, and the OPC was approved, it was approved to be a full OPC project. And that would include other things beside going to a safe injection site.
Mr. President, have the people that are trying to set this home up, do they have a location yet picked out to where the community would accept such a place?
Mr. President, I can't answer that effectively because they could well have a location. They have looked at different locations and they are working hard to make a determination about how to move forward.
Mr. President, did they ask for the additional $1.1 million?
Yes, Mr. President.
Is there, Mr. President, is there a clawback in there if they don't have to use those dollars in a certain amount of time to where we could use this money to help, more helpful in other areas?
So, Mr. President, knowing that Burlington has a very high number of folks who are using substances inappropriately, knowing that they could use that money very much. So this isn't a debate about whether or not they can use the money, but I will direct you to the bill itself before us that asks the Opioid Advisory Committee to look at the current programs that are being funded through the Opioid Settlement Fund and to make a recommendation about that. Certainly, as time goes on, we would want to know that this project is going to go forward. And if it doesn't, I would think that the city of Burlington would take it upon itself to reevaluate or perhaps seek of the advisory committee or the legislature a different use of the funds. But I can't answer any of those questions, Mr. President. That's really integral to the work that the city of Burlington is doing right now.
Mr. President, on the needle exchange of the $850,000, I think I heard the reporter say that that wasn't asked for, that it was added into the committee, but where did that number come from and that need of that $850,000?
Thank you, Mr. President. This is the harm reduction program for AIDS services organizations. And so the harm reduction programs provide low barrier, community-based services to people who use drugs. Through mobile outreach, they provide syringes, they provide sharps containers for disposal, they provide naloxone distribution, overdose prevention education, drug testing, HIV and hepatitis C testing, wound care supplies, basic needs supports, including food, and services are delivered in a non-judgmental way for folks. This is an important program. I understand that people are very concerned about what they find when they're walking down the street. This program is also very much concerned about that, and which is why the sharps containers are included within the program. They also have overdose response trainings for community folks, drug checking services, fentanyl and xylazine test strips, and a number of other things, wound care kits and so on. So it's not just a syringe program. It is much more, it's much broader than that.
Well, Mr. President, it wasn't asked for. It was just offered to the folks.
It was asked for, Mr. President.
Okay, I apologize. I misheard during the reporting. I thank the reporter. I'm sorry that I'm a little bit passionate about this, but when you've been fighting on something for this your whole life, and you've been affected by it, and your life personally has been affected by it, it is very personal to me. And I just don't think that this bill is being very serious on some parts of it as far as really trying to get people not to be affected by addiction. And I just think that we could find a better use for almost $2 million worth of dollars to actually work to fight addiction, to cure people, to save lives in that way so that they can be productive. Thank you, Mr. President.
Senator from Chittenden.
Thank you, Mr. President. And I sympathize with the senator and his history. I sympathize with all of the people who have been affected by the opiate epidemic. One thing I would point out is that we are in the midst of a decline in fatalities. They are down for the third year in a row. To my mind, 3 is a pattern, and that suggests that we're on the right track. That what our Health and Welfare Committee and Appropriations Committees have done over the last number of years has been effective. So if we were here seeing 3 years of rising death statistics, I would be much more concerned than I am. I don't think anyone should be celebrating. People are still dying, over 100 Around 170 people died last year from this affliction. But what I would say is that we have gone at it in good faith as a legislature. We have tried things because we were out of solutions. Those things appear to be working. So I do want to congratulate the senator, the chair of Health and Welfare, for some success on her efforts. Thank you, Mr. President.
Are you ready for the question? Senator from Addison.
Thank you, Mr. President. I am the Senate's representative on the Opioid Settlement Advisory Committee and have been since the start of the fund. And I do want to underscore some of the things that we just heard from the pro tem and also from the chair of the Committee on Health and Welfare. And I too share in your grief, Senator, about all of the senator from Essex, about all of the people who have been impacted by this horrible epidemic, and I'm sorry for the losses in your family. And I would agree that with this senator from Chittenden Central, that we have been successful in appropriating funds and supporting programs around the state that have led to a reduction in the deaths from opioid overdoses. For 3 years running, we've seen a decline, and that has been during the time when we have started to really use these funds and to use these funds in a strategic way. I can tell you, as the senator who reported the bill said, the Opioid Settlement Committee heard from, I think, 67 proposals. We went through every single one. The Opioid Settlement Committee includes 2 legislators and members from law enforcement, members from lived experience with drug addiction, members from the judiciary, members from social services, and members from our municipalities. So it's a broad group of people who are reviewing these applications and coming to an agreement on which ones to prioritize. And this bill largely follows the recommendations of the Opioid Settlement Advisory Committee that spent months, we spend months going through these proposals to try to make sure that we're spending this money strategically and to try to make sure that we're spending this money throughout the state to target it to programs and communities that need it the most. I'm especially appreciative that the committees, both in the House and the Senate, found ways to fund the youth prevention programs and using the special fund, the other special fund for these. These are programs throughout the state that really target prevention services to young people, starting at an early age to prevent them from ever getting into using drugs. And they've been very effective, and they cover communities throughout our state. And I just want to highlight that as something. The other thing that we heard of over and over again that is necessary is recovery housing. And this bill does a really good job of putting money toward recovery housing, level 3 recovery housing, which is the highest level, but also supporting existing programs. We heard that over and over again, that is a need, and this bill covers that. I will point out that there is in this bill and in the future, there is a mechanism for reversions to the fund. So if this funding is not used for something we've appropriated it to in the past, it can be reverted back to the fund and reappropriated for things in the future. So if the money for the opioid overdose prevention center is not used, it can be reverted back to the fund. And we did hear of the need for the syringe services and the prevention services that the senators have discussed. That is something that is incredibly important throughout our state to make sure that we have effective services to deal with syringes and to prevent HIV and other diseases. And I also just want to point out one thing that's really important in the bill, and I appreciate the Appropriations and Senate Health and Welfare Committee for putting this in, which is about the Department of Health actually appropriating these or allocating these funds and sending out these funds in a timely manner. These funds for this current fiscal year for some of the programs were not sent until March. That is 9 months into our fiscal year, and that is one of the reasons why some of these programs have been struggling, is that the Department of Health has not been getting them the funds in a timely manner, so that they have not been able to expend them during the fiscal year, and this bill has a mechanism for making sure that those funds are delivered to programs in a more timely manner, and I really appreciate that. Because these community-based organizations in particular are small and they can't make up for it if they don't get the funds in a timely manner. So overall, I just ask the Senate to support this bill, to support the work of the Opioid Settlement Advisory Committee, and the good work that we as a state have been doing to reduce the opioid deaths in our state, Mr. President. The data shows that we've been doing it effectively. This bill continues along that path and provides mechanisms for check-ins if there are funds that are not used. So I hope the Senate will support this effort. Thank you, Mr. President.
Are you ready for the question? Senator from Addison.
Thank you, Mr. President. May I inquire for the presenter of the bill?
Presenter is interrogated.
Thank you, Mr. President. A question I have, it's a concerning question that once we have a safe injection site house that we can use, that if a minor comes in, Mr. President, and the parents don't know, the child ODs and dies there, is the state or community that the child used the drugs at, who's going to be held responsible for that?
Mr. President, that's a great question, and I guess I'd have to turn to my Judiciary Committee to respond to that and answer the question.
No. You're still being interrogated, Senator.
Thank you, Mr. President. If the senator would like to yield to judiciary.
The senator cannot yield to the other senator. But if you are done questioning the senator from Chittenden
I am, Mr.
Southeast, you can say, thank you, Senator.
Thank you, Senator.
And you could ask to interrogate the chair of judiciary, but it would be he's interrogated if he so chooses.
Thank you, Mr. President. Mr. President, could I interrogate?
The senator from Windham is interrogated if he so chooses.
Thank you. I briefly spoke with legislative counsel. I can come back with a solid answer before third reading. And that's really the best that I can provide at the moment. I don't have the answer on my fingertips.
Thank you, Mr. President. I appreciate that.
Senator from Rutland.
Yeah, I have a point of order, Mr. President.
What is your point of order?
Is the vote that we are about to take on the amendment from the Appropriations Committee and then a subsequent vote to follow on the underlying bill?
That is a point of inquiry, and I believe that is correct.
Thank you.
Yeah. Just so everyone is clear, we vote on the appropriations amendment first, the health and welfare amendment second, and then the bill. The question is, shall the recommendation of proposal of amendment of the Committee on Health and Welfare be amended as recommended by the Committee on Appropriations? Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay.
No.
The ayes appear to have it. The ayes do have it. And you have amended the recommendation of proposal of amendment of the Committee on Health and Welfare as recommended by the Committee on Appropriations. The question now is, shall the Senate propose to the House to amend the bill as recommended by the Committee on Health and Welfare as amended? Senator from Franklin.
Thank you, Mr. President. I want to thank the Chair of Health and Welfare along with the committee on the 5-0 vote. Most of this bill, in my opinion, is a good bill. The Chair and I have had several conversations about this. My concern would be on page 3, line 1, $850,000. We took testimony that over the past 3 years, there's been $2.7 million appropriated toward this fund, to the opioid recovery funds. It's great that we've gone down 25% as far as losing license, state of Vermont. We'd like to get to 0. I don't know if we ever will. But having said that, my concern with this $2.7 million, or even 3.1 over the past 4 years, is we're only addressing one end of this pandemic. The other end concerns our playgrounds, our Little League fields, our football fields, where each year in St. Albans in Franklin County, there's a group of folks who walk through the parks, walk through the Little League fields, whatever that may be, picking up syringes and orange caps and so on and so forth. And although we're saving lives on one end, which is a good thing, we're endangering our kids, our grandkids, the neighbors' kids, and everybody else on the other end of the spectrum. We're doing nothing to address that. We've been told that, well, the Howard Center in Burlington's going out picking up syringes in and throughout that area there, but that doesn't help St. Almo's or many other outlying communities here. So you're probably going to see another amendment to this. I would just like to see us slow this down a little bit till we have the opportunity to address maybe some concerns with those agencies that receive the syringes as to what they may be doing to alleviate this problem as far as endangering our children on our ball fields and throughout. I found them personally on my lawn and my driveways. So over the course of $2.7 million, it's working. The syringes are out there, but they're not under control. They'll be found all over the place. And I think that we're endangering a certain portion of our public here. So once again, I thank the committee. I thank the chair. I don't think we're that far apart. I've discussed this with the chair, but you'll probably see another amendment. But thank you, Mr. President.
Are you ready for the question? Senator from Chittenden.
Thank you, Mr. President. This is such a difficult issue. There's just no question about it. And people have passions all over the place. It's just, and it won't end. But what we are seeing, and I really thank the senator from Chittenden Central for pointing out the recent report from the Department of Health about the decline in opiate deaths. However, we're seeing a transition now to new drugs, to stimulants, fentanyl. That's where it's going. And so we need to be on our toes. And we also need to appreciate the work that people are doing. And thank you, Senator from Franklin, for pointing out our discussions, because we are not far apart. No one wants to find syringes walking down the street. Nobody. We all know that. And we've had people attempt programs to correct that. And it's tough. I mean, it would be great to see a community put together a proposal for the Rural Health Transformation Grant to say, we're going to go out and collect all the syringes, but you pick one up and the next day there's another one. But if we don't have these programs, people are going to even die. They'll die. They'll contract AIDS. They'll contract other diseases because of dirty syringes. So it's a rock and a hard place. We get that. But the work that we're doing here in this bill is critical. And one piece of the bill that I think is really important, a couple of places. One, we're separating out those substance misuse prevention fund. That's a separate fund. That does go to the kids. It does go to younger people. Don't ever do anything that gets you into addiction. And then we're separating out the opioid abatement fund, which says we're treating you, we're intervening where you are, we're helping you as much as we can. We are trying different things. Some of those things aren't going to work. And we're taking a hiatus next year to look at the overall process within the Opioid Advisory Committee. And I wager to say, I would think that both House and Senate committees will be looking again at all of this, because that's our job. We have to do this. So I have a lot of empathy for all the comments that have been made today. There's no question about it. We did pass a bill for the OPC in Burlington. We have to allow for it to go forward with the time remaining for the funding that was dedicated. We can't just stop it in its tracks because we don't like it, or we think it's not working, or we haven't found a place. All these things are true. And it takes time sometimes, and maybe things change. So, you know, I always tell my committee, let's move with alacrity, but this is a place where I say, let's slow down a little bit and think about what we're doing. And I think the bill allows for us to do that. And I think the bill is doing a great deal of work for folks who are in dire need, whether they're going into Jenna's Promise, or they're going into the local Turning Point, or they're receiving the services that they need elsewhere. So I would say, please vote for the bill, Mr. President.
Senator from Essex.
I think before we start high-fiving and belly bumping everyone about the successes that we're having in Vermont, that we ought to really look at nationally, that we're actually doing a better job reducing the deaths on opioid uses and everywhere, and they're not passing out free needles and setting up drug houses. Thank you, Mr. President.
Are you ready for the question? Senator from Franklin.
Yes, I'm sorry. May I interrogate the presenter of the bill?
The presenter is interrogated.
It's really good that we're saving lives and we're preventing HIV and AIDS and so on and so forth, but does the chair know, Mr. President, as to if a syringe lays roadside, how long that will be before the possibility of getting AIDS, or like some child walk along picking up and sticking themselves? Is there an expiration date as we don't have to worry about this, or is it forever because we're saving one end of it? What about on the other end?
I think it's a difficult question. I don't think you can answer that question, Mr. President. Really.
Mr. President, is that an answer we could get before third reading?
Can you repeat the question?
I'd like to know the life of a needle lying roadside, because we're putting clean syringes out there so that they're not contracting AIDS, HIVs, whatever that may be. But that needle's been used, is placed roadside. Is there an expiration as to when a child can pick this up and actually get pricked with it, as to they won't contract AIDS or HIV? Does it expire at some point in time, that risk?
You know, viruses like the HIV will live on environmental surfaces for a short period of time. If it rains, it might eliminate it. I don't know the exact time for HIV. The COVID virus can last for several days, and some of our cold viruses will last for a couple of days. HIV probably similarly.
Well, I think it's an important question. If possible, I'd certainly like the answer to that at third reading, Mr. President.
I'm happy to look that one up for you, Mr. President.
Thank you. Thank you, Senator.
The question is, shall the Senate propose to the House to amend the bill as recommended by the Committee on Health and Welfare as amended? Are you ready for the question? If so, all in favor, say aye.
Aye.
All opposed, nay. No. The ayes appear to have it. The ayes do have it, and you have proposed to the House to amend the bill as proposed by the Committee on Health and Welfare as amended. The question now is, shall the bill be read a third time? Are you ready for the question? If so, all in favor, say aye. Aye. All opposed, nay. No. The ayes appear to have it. The ayes do have it, and you've ordered third reading of H 660. We will be passing over S 327. That brings us to H 635. We have on the calendar for action H 635, introduced on January 9th of 2026. It was referred to the Committee on Institutions, which reports it has considered the bill and recommends that it ought to pass in concurrence. Affecting the revenue of the state, the bill was referred to the Committee on Finance, which recommends that the bill ought to pass in concurrence. Listen to the second reading of the bill.
H 635, an act relating to eliminating Department of Corrections supervisory fees.
Recognize the senator from Bennington, Senator Plunkett, for the report of the Committee on Institutions.
Thank you, Mr. President. H 635, you've now heard the title of the bill, and it does pretty much exactly what the title says. It eliminates the Department of Corrections supervisory fees. So just to be clear, so the chamber knows, the Department of Corrections has responsibility for essentially two groups of people. There are those that are incarcerated, and no, we do not charge people for their own jail time. And then there are folks that are under community supervision. It's the community supervision folks that we're talking about here. That's probation, parole, furlough, a couple of others. And so what the bill does, it eliminates the authority of the Department of Corrections to assess, collect, or bill supervisory fees from those individuals. It also forgives outstanding supervisory fees and also prohibits use of fee non-payment as grounds of violating supervision. That's not the case now anyway, but it is in the bill. So the history of supervisory fees is a little bit unclear. Vermont tried to do it in the 70s, in the early 70s, there were supervisory fees, got rid of it towards the end of the 70s. Then in the 90s, it was added again. The current program has been in effect since rules were adopted in about 2008. And what it is the Department of Corrections can charge up to $30 per month for individuals on community supervision. In practice, it's $15 a month, and there are a number of exemptions from that program. The Department of Corrections collects it in various ways, which I won't go into. But this bill primarily is not a policy bill, it's a finance bill. But there is a little bit about supervisory fees and the purpose of community supervision. We heard a little bit about how there is some accountability aspects to collecting fees from those on community supervision. But mostly we heard that this other cost on top of all of the other fees that folks on supervision have to pay, as well as the indirect costs of simply being on probation, getting to the probation office, or perhaps not being able to work in that time, is something that on balance doesn't support the purpose of community supervision. But mostly we heard about the cost of the program. And so just so folks know, there's approximately $600,000 that could be collected each year from supervisees, and roughly half of that is actually collected. And the overall cost of the program, as we heard from the Department of Corrections, costs about $200,000 more than what comes in. So simply put, the state loses money from administering these supervisory fees. The other aspect of this is that there is of course outstanding debt, and this is debt that essentially is unable to be collected, and that's about $3.5 million right now. So that is an amount that will be forgiven. So just to step through the bill, Section 1, it amends the powers of the Commissioner of Corrections in 28 VSA 102. It strikes out the subsection that allows for the collection of $30 per month fees. The Section 2, it tells the Department of Corrections to cease all assessment and collection of the supervisory fees, and that's where it also puts in that it cannot be a violation for failure to supervise the fees. And that is also the forgiveness section of the bill. Section 3, technically not necessary, but it does indicate that the Department of Corrections will notify the Secretary of State of any rules or policies that are now in place that are struck out from the loss of this authority. That happens by aspect of law anyway, but we have put that in there as a backstop for that. Section 4 is the effective date. Now this is going to go into effect July 1st of 2027. So not this year, another year later, and that's essentially to allow the Department of Corrections to calculate this into their budget. So the committee heard from the reporter from the House. We heard from the Deputy Commissioner of Corrections, Ledge Counsel, heard from Joint Fiscal Office, and we also heard from the Deputy Director of Field Services for the Department of Corrections. And the committee vote was 4-0-1, and we ask for the chamber's support.
Recognize Senator from Caledonia, Senator Beck, for the report of the Committee on Finance.
Thank you, Mr. President. We found this to be an interesting bill. Your Finance Committee, I think, you learn something new every day, and I don't think many of us understood that we actually have been trying to charge fees to our formerly incarcerated population as they go through probation and parole. The senator from Bennington made the point that this is a program that is costing the state money. A lot of debt has piled up. In many cases, the fees aren't collected or they're only partially collected, and the Department of Corrections recommends that we end the program. Your Finance Committee agreed with that. In the, just to make sure there isn't any hit to the general fund budget for FY27, this would take effect in July 1st of 2027 for FY28, and it would eliminate all debt. We heard from JFO, we heard from Legislative Council, and the vote was 7-0-0 in your Finance Committee, and we recommend that the bill ought to pass. Thank you.
The question is, shall the bill be read a third time? Are you ready for the question? If so, all in favor, say aye. Aye. All opposed, nay. The ayes have it, and you've ordered third reading of H 635. We have S 239, and it was passed by the House with proposal of amendment. The question is, shall the Senate concur in the House proposal of amendment? Senator from Chittenden Southeast.
Thank you, Mr. President. I would ask for a brief recess and Health and Welfare to meet briefly in the corner.
We'll take a brief recess. Will Senate please come to order? Senator from Chittenden.
Thank you, Mr. President. Senate Health and Welfare has reviewed the language as it came back to us from the House. This is, recall, this is the bill on child abuse and neglect reporting working group. And the language that returned to us is very much intact. There are actually some improvements in the language, and the biggest change was the addition of one additional member on the working group itself, and that would be number 11, the Agency of Education. So the committee by straw poll unanimously supports this proposal, and we ask for the Senate to concur. Thank you, Mr. President.
The question is, shall the Senate concur in the House proposal of amendment? Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay. The ayes have it, and the Senate has concurred in the House proposal of amendment. Yep, we will be skipping over S218 and moving on to, we've already done the third reading of H944, so we're now on to H171. We have in the calendar for action, H171, introduced on February 7th of 2025. It was referred to the Committee on Judiciary, which reports it has considered the bill and recommends that it ought to pass in concurrence. Listen to the second reading of the bill.
H171, an act relating to criminal justice agency protocols for an officer-involved shooting.
I recognize the senator from Franklin, Senator Norris, for the report of the Committee on Judiciary.
Thank you, Mr. President. OIS, officer involved shooting. A term you don't want to hear or be involved in. Having said that, unfortunately, we do deal with this in Vermont. I can assure you, this is a strain, both emotionally and psychologically, on all parties involved. But sometimes during the investigation, time lapses. We may not be a well-organized team or well-oiled machine. H171 is an attempt to address this issue for all individuals who may be involved one way or the other. An act relating to criminal justice agencies protocols for an officer-involved shooting. The Senate Committee on Judiciary voted 5-0 favorably on H171 as passed by the House without amendment. The intent of this bill is to facilitate cooperation amongst the entities responsible for investigating an officer-involved shooting, OIS. So there's a well-understood protocol for addressing such incidents that instills public trust in investigations and resolves investigations in a timely manner to provide certainty to all parties involved. The bill directs the Attorney General's Office, the Vermont Department of State's Attorneys and Sheriffs, the Department of Public Safety, and the Vermont Associations of Chiefs of Police to work collaboratively to identify a protocol and best practices for independent investigations of an OIS. Subsection C identifies the issues to be addressed by protocol. 1, define officer-involved shooting and what types of incidents trigger an investigation. 2, to define conflict of interest and identify the appropriate steps to manage any conflicts for law enforcement and prosecutors. 3, delineate the process for informing the AGO, the DSAS of an OIS. Describe the process for, number 5, describe the process for prosecutorial assessment of the investigative materials, including dual and independent assessments. 6, evaluate the process of investigation and prosecutorial review of an OIS to ensure timely criminal charging determinations and identify and address existing barriers to timely criminal charges determining. And number 7, outline the final outcome of the investigation and assessment of an officer-involved shooting, such as clearing a law enforcement officer or filing criminal charges. To inform their efforts to develop a protocol, the entities are to examine other jurisdiction protocols for an officer-involved shooting investigation to determine best practices. On or before December 1st, 2026, the entities are required to submit one written report to the House and Senate Committees on Judiciary detailing their work and agreed upon protocol for an officer-involved shooting investigation and any legislative changes necessary, including appropriations to effectuate the protocol. This came out of your Senate Judiciary on a 5-0 vote. And I do not have a list of witnesses. I don't know if we heard from too many witnesses, but I can get that before third reading if you so desire. And we ask for the Senate's support. Thank you, Mr. President.
The question is, shall the bill be read a third time? Are you ready for the question? If so, all in favor, say aye. Aye. All opposed, nay. The ayes have it, and you've ordered third reading of H171. That brings us to H577. We have on the calendar for action H577, which was passed by the House on May 8th of 2029. was referred to the Committee on Health and Welfare, which reports it has considered the bill and recommends that the Senate propose to the House that the bill be amended as it appears starting on page 2667 of today's calendar, and that with such proposal of amendment, the bill ought to pass. Affecting the revenues of the state, the bill was referred to the Committee on Finance, which recommends that the bill ought to pass in concurrence with proposal of amendment as recommended by the Committee on Health and Welfare. Affecting the expenditures of the state, the bill was referred to the Committee on Appropriations, which recommends that the bill ought to pass in concurrence with proposal of amendment as recommended by the Committee on Health and Welfare. Listen to the second reading of the bill.
H 577, an act relating to establishing the Vermont Prescription Drug Discount Card Program.
I recognize the senator from Chittenden, Senator Lyons, for the report of the Committee on Health and Welfare.
Thank you, Mr. President. Your Senate Health and Welfare brings this bill to the full Senate with two small amendments. The bill itself will allow for Vermont to enter into an agreement with other states to negotiate and provide low-cost drugs, prescription drugs, to Vermonters. So it will be, the program was established by Oregon and Washington states, and now other states have joined in. Nevada, Arizona, Connecticut, and Colorado also being a part of the system. And this organization now is a collaborative called, it's Array, works through Array RX, a collaborative system to provide Vermonters with a prescription drug card. And when that card is taken to the pharmacy will offer the prescription drugs that are included in the program at a reduced price. And the one benefit, biggest benefit, I think, for folks, beside the low-cost drugs, and just as an indicator, the savings that we're seeing for out-of-pocket is 80% savings for generics and 20% on brand names. But a large benefit also included within the bill is that out-of-pocket expenditures are counted toward the payment for the drug is counted toward out-of-pocket expenditures for folks on their insurance. So as we looked at the bill and we realized what a benefit this can be, it is something offered through the Treasurer's office, and the Treasurer has been working with other states to have this happen. The money that will be paid to go for the program will go into a special fund that is already in the Treasurer's office, the Financial Literacy and Economic Empowerment Trust Fund. And any monies that are received by the program from transfers, gifts, grants, donations, or other sources will be placed in that fund to benefit the development of the program. So the two amendments that we have are to, on the first section, to ask for reports to come back on or before January 2028, understanding that it's going to take some time to set up the program. So we'll get a report back and then annually from the state treasurer on the activity of this this prescription drug cost program and the viability of Vermont pharmacies who are part of the program. The larger pharmacies will participate, and the cost will really, any savings that go to residents of Vermont will be covered by the larger pharmacies. Our smaller pharmacies actually will not have to participate, but they may participate. That's part of the current laws for our smaller pharmacies. So, but this report will look at the effect of the prescription drug program the Vermont Array RX program, specifically on pharmacies in the state of Vermont. So that's the first amendment, and then a word left out after drug discount in section 2, adding drug discount card before the word program. Mr. President, as we took testimony on this bill, we realized what a benefit it can have for Vermonters. And it's also a benefit to the state, since we will be sitting at the table making decisions about which drugs will be covered, how they'll be covered, and how we can ensure that Vermonters are saving out-of-pocket costs for prescription drugs that, as we all know, have reached sky-high costs. We heard from the reporter of the bill, we heard from Joint Fiscal, we heard from members of the Office of State Treasurer, we heard from Vermont Legal Aid, Department of Financial Regulation, Blue Cross and Blue Shield, and AARP of Vermont, all of whom were in agreement about the bill and support the bill going forward. This is a critical, important, and a very important program for the state to establish through the Treasurer's Office. And so your Committee on Health and Welfare voted 5-0-0 to bring our recommendation to you. Thank you, Mr. President.
Thank you, Senator. Question is, shall the Senate propose to the House to amend the bill as recommended by the Committee on Health and Welfare? Are you ready for that question? If so, all right. It's working from this script. Got it. I'd like to recognize the senator from Chittenden Central for the report of the Committee on Finance.
Thank you, Mr. President. There are fees in the Array RX bill, H577. These are fees that are agreed upon by the Drug Collaborative, who negotiates these fees with the pharmacy benefit manager. The fee is always less than the discount, and having spoken with the Treasurer's Office yesterday, although they can't disclose the exact amount, it's usually in the range of a couple of dollars. So your Senate Finance Committee, who heard from the Treasurer's Office and Ledge Counsel, considered these fees to be de minimis and part of the Array RX program, and we voted this bill out of committee 7-0-0, and we ask that the Senate concur. Thank you, Mr. President.
Thank you, Senator. I'd like to recognize the senator from Chittenden Southeast for the Committee on Appropriations.
Thank you, Mr. President. Within the bill, there's $50,000 appropriation. The Appropriations Committee reviewed that and its purpose. The purpose is to provide education to Vermonters about the availability of the card, how to access the card, whether electronically or in paper. And what we understand from other states is that without having direct communication, effective communication to the citizens of Vermont, then this will not be as successful as it might be. So your Appropriations Committee concurred with the proposal from the Senate Health and Welfare Committee to appropriate $50,000 for purposes of communicating to Vermonters about the Array RX program. The vote in Senate Appropriations was 5-0-2.
Question now is, shall the Senate propose to the House to amend the bill as recommended by the Committee on Health and Welfare? Are you ready for that question? If so, all those in favor signify by saying aye. Aye. All those opposed signify by saying nay. The ayes have it, and you have proposed to the House to amend the bill as proposed by the Committee on Health and Welfare. Question now is, shall the bill be read a third time? Are you ready for that question? If so, all those in favor signify by saying aye. Aye. All those opposed, nay. The ayes have it, and you have ordered third reading of H577. We have on the calendar for action H583. It was referred to the Committee on Health and Welfare, which reports that it's considered the bill and recommends that the Senate propose to the House that the bill be amended as appears at page 2668 in today's calendar. And that with such proposal of amendment, the bill ought to pass. Please listen to the second reading of the bill.
Page 583, an act relating to clinical decision-making.
I'd like to recognize the senator from Chittenden Southeast, Senator Lyons, for the report of the Committee on Health and Welfare.
Mr. President, I would respectfully ask if we might pass over this bill.
The Senate will pass over that bill. That will take us to H588, which was referred to the Committee on Government Operations, which reports that it has considered the bill and recommends that the Senate propose to the House that the bill be amended as appears at page 2668 in your calendar, and that with such proposal of amendment, the bill ought to pass. Affecting the revenues of the state, the bill was referred to the Committee on Finance, which recommends that the bill ought to pass in concurrence with proposal of amendment as recommended by the Committee on Government Operations. Affecting the expenditures of the state, the bill was then referred to the Committee on Appropriations, which recommends that the bill ought to pass in concurrence with proposal of amendment as recommended by the Committee on Government Operations. Please listen to the second reading of the bill.
H588, an act relating to professions and occupations regulated by the Office of Professional Regulation.
I'd like to recognize the senator from Chittenden Central District for the report of the Committee on Government Operations.
Thank you, Mr. President. The annual OPR bill updates our professions that are regulated by the Office of Professional Regulation. They have a wide range of professions that they have the jurisdiction to regulate, including social workers and massage therapists and funeral directors and many more. What this bill proposes to do is explicitly enable the Office of Professional Regulation to rescind licenses in instances of administrative error, non-payment, loss of a compact license, or privilege. And so we have expanded our use of compact licensure. And based on the current reading of the law, if someone were to be licensed in another state but part of a compact that can practice in Vermont and lost their compact licensure, without this update to language, our Office of Professional Regulation couldn't actually rescind that license to practice in Vermont. So this is an important protection for people who are seeking services from compact licensees. It also enables OPR to enforce against attempted fraudulent or deceptive procurement or the use or fraudulent or deceptive use of a license. So again, this is an important protection mechanism, which is really the role of regulating through the Office of Professional Regulation, is to provide protection to the public. It requires that the Professional Regulation Board members be adults. Some of our professions are regulated by a board of peers. I'll use social work because I know that one well. The social work board is a group of social workers that are part of the regulatory process. And there are many of our professions that have that regulatory process using this type of board, and this would require that those members be adults. It also creates an additional combination of education and experience as prerequisites for accountant licensures. This is really aligning with what other states do and really with what current practice is. It's aligning the language in the law to allow those accountants to have the sort of typical combination of experience and education. It creates a limited academic dentist license. This is really exciting. This is part of our project to start a dental school here in Vermont. These limited service licenses will practice under the supervision of a fully licensed Vermont dentist, providing services and education at our dental school, which should be opening soon. It removes the requirement for advanced practice nurse license renewal to include documentation of completement of the ARPN practice requirement. Again, this is really kind of aligning with general practice. It's not changing the requirements to get to that license. It's just removing language that is not necessary. One of the other really important parts of this bill is that it will enable pharmacists to prescribe, order, or administer tests for COVID-19, influenza, and streptococcal pharyngitis, as well as HIV, and subsequently provide treatment for those. HIV is a little different, and I'll explain that in a minute, but to provide treatment to cure or treat influenza, COVID-19, and streptococcal pharyngitis. And in the instance of an HIV test, if the person tests negative, it would allow them to provide prophylactic treatment, thus preventing the person from contracting HIV. This is part of the rural health transformation work that we have been doing. We have a lot of rural communities that might have difficult time accessing treatment to these lower level things at a primary care doctor, and they might be forced to go to the emergency department or urgent care. And this allows pharmacists to provide those tests, which they are already doing, and then provide the treatment for, or in the instance of HIV, to prevent contracting the illness. This enables OPR to create temporary policies to supplement psychological licensure educational requirements, notwithstanding any contrary rules. Next year, you should expect an expansive bill around how we modernize and create workforce development in the mental health fields. But I asked the Office of Professional Regulation at the beginning of the session if there was any low-lying things that we could do right now, knowing that there's such a crisis in that field, and this is the one thing they were able to come back to us with. This also eliminates the advisory committee on midwifery that reports to OPR and the Commissioner of Health, and changes the license renewal requirement for midwives. Currently, they have to submit individual practice data, and this practice data will now be at the discretion of the Director of the Office of Professional Regulation. That information is found elsewhere, and it is redundant that they are having to report it as part of their relicensure process. And the advisory committee was really put in place as midwives came on board as a licensed profession, and has been found to be, again, sort of redundant and unnecessary now that they're fully a licensed profession with their own advisory board. This also modifies the definition of practice and funeral service to include the disposition of human remains by cremation, alkaline hydrolysis, or natural organic reduction. This requires the Office of Professional Regulation to report on any possible professional regulation of speech-language pathology assistance. This is really just re-looking at a previous Sunrise report that was done, I believe, in 2014, updating it for the current moment, because that was quite a while ago, and then moving forward. We currently license speech-language pathologists, and in that process, we seem to have forgotten to license their assistants, and so this is a step forward in that direction. This will also enable the Board of Medical Practice to conduct criminal background checks for certain professions. That is in a manner similar to OPR. OPR is able to conduct background checks on mental health providers, on massage therapists, on quite a number of different professions, and the Board of Medical Practice needs the ability to do that same thing for professions that might be impacting the public depending on their criminal background history, that it would be important for them to have that information. Walking through the section by section of the bill, section 1 is the section allowing the Office of Professional Regulation to rescind licenses in those instances where a license is lost in another place or they didn't pay the proper administrative fees. Section 2 retitles for clarity, the powers of the board on those advisor professions and the rescission process. Section 3 is again more of this enabling language, allowing compact license holders to have their license rescinded by OPR if they lose their compact license. Section 4 is really technical changes, creating clarity, removing a double negative. Section 5 amends and adds a definition of what constitutes unprofessional conduct in the instances of fraudulent or deceptive procurement of a license. Section 6 is the section that makes all of the board members of board and advisor regulated professions be adults. Section 7 is around license denials for foreign applicants. It incorporates proper cross-references, really largely technical in nature. The next few sections, 8, 9, and 10, actually it might be 11 too. Oh, just 8, 9, and 10 are the sections around the CPA, licensure and regulation and education. Sections 11 and 12 are the sections around creating the limited service dental educator position licenses. And there will be no fee for those licenses because those licensees will not be practicing full-time in Vermont and will be providing services to people who might not otherwise be able to access dental services at all. Section 13 is the definitions around funeral services. Section 14 is that removal of the certain documentation for the APRN practice requirements. Section 14A through C are the sections around pharmacists and the allowance to test to treat. Section 15, the section about psychologists. Section 16 is around dissolving the midwifery advisory committee. And section 17 is the section regarding speech language pathologists. And section 18, an important section, one that I imagine we will be revisiting yet again in a future year, and many who have been here before know we've revisited this many times, and this is the section on massage therapists and the touch professionals. This will create a requirement that massage therapy establishments be registered. Currently, massage therapists and other touch professionals need to be registered with the Office of Professional Regulation. Registration does not come with any type of education requirement, but it is mandatory. This is adding to it that the establishment where 2 or more massage therapists or touch professionals are practicing will also need to be registered. This is in response to trying to do more to prevent human trafficking within these professions. And trying to be able to respond to more quickly and more effectively the practice of that type of behavior, as well as the unfortunate instances of sexual abuse and assault within those professions. So it is an important section, one that we in all likelihood will get to revisit yet again. And the section 19 is the allowance of the Board of Medical, or 19A is the allowance of the Board of Medical Practice to do criminal background checks. Section 20 is the effective dates. Section 1 through 10, 13 through 17, 18A and 19A shall take effect on passage. Sections 11 and 12, which is the sections on dentist, the limited service dentist licenses, shall take effect on September 1st, 2026. And section 18, which is the massage therapy, bodyworks, and touch professionals, section 19, and section 19, which also is part of the bodywork stuff, section shall take effect on December 1st, 2026. Your Committee on Government Operations heard from 19 witnesses. I'm not going to read through them all, but if there's a specific witness that you are interested to know if we heard from, I'm happy to let you know. And the vote out of committee was 5-0-0, and we ask for the Senate's support.
Recognize the senator from Addison, Senator Hardy, for the report of the Committee on Finance.
Thank you, Mr. President. As the senator from Chittenden Central noted, there are some fees in this bill. This bill will increase revenue to OPR by requiring massage and bodywork establishments to pay a standard fee of $100 at registration and $275 to renew their license biannually. Solitary practitioners who just work alone would be exempt from this requirement, and establishments with just 2 professionals would pay registration fee of $50 and a renewal of $75. OPR indicates that this could result in approximately $15,000 of revenue in FY27 and $40,000 in FY29 and in odd fiscal years thereafter, because this is a biennial renewal process. Even numbered years would see minimal increases if there are new establishments entering the profession. The remaining provisions of the bill have a minimal impact, fiscal impact. OPR estimates that 6 dentists would take advantage of the new $0 academic license fee for dentists. Current fees for dentists in Vermont is $655. However, some of these dentists could be currently licensed out of state and not pay fees in Vermont. We did have a discussion in the Finance Committee about why we would set a fee of $0 in statute. And OPR asked that we do this so there's not confusion about what the fee is. They didn't want to get a lot of questions about what is this fee. So putting it at 0 makes it clear. It also encourages these dentists to come train dentists in Vermont. So setting it at 0 helps encourage folks to come into the state. Overall, this is a fairly minimal impact on the revenues of the state, Mr. President, and the Finance Committee voted 7-0 to support the bill. Thank you.
Recognize the senator from Lamoille, Senator Westman, for the report of the Committee on Appropriations.
The Appropriations Committee reviewed the bill, and we also went through the same fiscal note that the Committee on Finance went through. We reviewed the sections with Massage and Body Works. We also spent some time talking about the dentist school and the training of dentists here because we've had such a shortage, and we found minimal impact on the appropriations of the state, and we voted 7-0-0.
The question is, shall the Senate propose to the House to amend the bill as recommended by the Committee on Government Operations? Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay. Ayes have it, and you have proposed to the House to amend the bill as proposed by the Committee on Government Operations. The question now is, shall the bill be read a third time? Are you ready for the question? So all in favor say aye. Aye. All opposed, nay. The ayes have it, and you've ordered third reading of H 588. We have on the calendar for action H 606, which was passed. Senator from
Mr. President, if we might pass over 606 and move to H 611.
We will pass over 606. We have on the calendar for action H 611, which was passed by the House on May 8th of 2026. It was referred to the Committee on Health and Welfare, which reports it has considered the bill and recommends that the Senate propose to the House that the bill be amended as it appears starting on page 2702 of today's calendar, and that with such proposal of amendment, the bill ought to pass. Affecting expenditures of the state, the bill was referred to the Committee on Appropriations, which recommends that the bill ought to pass in concurrence with proposal of amendment as recommended by the Committee on Health and Welfare. Listen to the second reading of the bill.
H 611, an act relating to miscellaneous provisions affecting the Department of Vermont Health Access.
Recognize the senator from Chittenden, Senator Gulick, for the report of the Committee on Health and Welfare.
Thank you, Mr. President. Indeed, H 611 is an act relating to miscellaneous provisions affecting the Department of Vermont Health Access, also known as DEVA. This is the DEVA housekeeping bill for 2026. For those of you who may not know, DEVA is not an opera singer. DEVA is part of the Agency of Human Services, and it is responsible for administering the Vermont Medical Health Insurance Program and Vermont state-based exchange for health insurance. I'm going to go through the underlying bill, and then I'll proceed to the amendment, if that is okay with with Mr. President. Section 1 of the bill amends 18 VSA 4635. This part of statute requires health insurers with over 5,000 covered lives to produce and share a list of prescription drugs whose costs have significantly increased. The idea for this was to flag those drugs that were going up in price and have the Attorney General post them and then get relevant info from the manufacturers. It's been hard to get this information from manufacturers, so this work has not been completely successful. This provision in the bill would eliminate having DVA require the list. Because drug pricing and Medicaid are different, it makes sense to take DVA out of this process. Health insurers have to provide the list of drugs that have gone up more than 50% over 5 years or 15% over the last calendar year. And DVA is federally prohibited from sharing drug-specific net costs. So we believe this move makes sense and certainly support it. Section 2, you may recall last year we had a 430B drug pricing bill. This provision in Section 2 repeals that language because there are things happening at the federal level that might actually make the 430B pricing not something that the states can decide on. It's being done at the federal level. So it's a repeal of that language. Section 3 aligns Vermont statute with federal rule, makes some changes to the exchange and the Medicaid Advisory Committee. There must be no fewer than 22 members on this Exchange and Medicare Advisory Committee, and the new federal law requires that the committee include individuals who are also members of the Beneficiary Advisory Committee. And it takes out language that the commissioner may reappoint. And there's also a language change, and that's on page 7, lines 10 through 13. Section 4 makes a change to the reflective health benefit plans. When the federal government was discontinuing cost-sharing reductions, Vermont created these plans and so that they could load up on the silver plans to reduce costs. This changes the language to individuals only, and it removes and employees of small employers. Section 5 is cleanup language in the statute that amends CURB membership, 33 VSA Chapter 2031, which is the Clinical Utilization Review Board. Section 6. This is a change to the V-Farm eligibility. It's a minor change. They've always been using 225% of the federal poverty level to calculate eligibility, so this is a conforming change. Section 7, certain funds are set aside to cover future burial costs, and they can be excluded from Medicaid financial eligibility. DVA is proposing, with the support from the Vermont Funeral Directors Association, an increase to the burial fund exclusion amount. This amount has not been increased since 2002, and it would increase the $10,000 cap on irrevocable prepaid burial arrangements to $15,000 and implement the use of Medicaid payback requirements in the agreement with the funeral home to the extent that the funds are not fully utilized. And this, if you're interested, is Title 26, Chapter 1271, which is the funeral director chapter. Section 8 and 9. These sections delay for 1 year the date by which DVA has to seek a state plan amendment for doula services. They need longer to seek the plan amendment. Every state has a state plan, and this will be an amendment to our state plan, and it will take some time, but we are feeling optimistic that someday soon divas will be covered by Medicaid. Doulas will be covered by Medicaid. Section 10 is the effective date, which is July 1st of 2026. And now I will proceed to the Senate amendment, if I may. Thank you, Mr. President. The H611 amendment can be found starting at the bottom of page 2702 in the calendar. The first amendment, instance of amendment, has to do with discrimination against 340B drugs. It prohibits discrimination against a 340B covered entity by requiring data unless that data are required by the U.S. Department of Health and Human Services. The second instance of amendment has to do with OPR's duties with regard to doulas. We neglected to align the OPR rulemaking with the state plan amendment. So this is just aligning the dates. And again, we remain confident that we will get Medicaid coverage for doulas, but that date has been moved to 2027. The third instance of amendment, before I get into it, I'm going to give you a little bit of information. I'm not sure if everyone knows what PEP and PrEP are. These are HIV drugs. PrEP, which is pre-exposure prophylaxis, is a highly effective evidence-based HIV prevention medication. And when taken consistently, it reduces the risk of HIV by approximately 99%. PEP is an HIV post-exposure prophylaxis, and it must be taken within 72 hours of being exposed to HIV. A little bit of information, in 2022, the CDC reported 38,000 new HIV diagnoses across the country. And in Vermont, over the course between 2008 and 2017, VDH, the Vermont Department of Health, reported over 100 new cases in Vermont. These numbers should be zero. We actually now have the tools in our toolbox to have zero HIV infections. So access to HIV prevention medications, including PrEP and PEP, is a proven health strategy that delivers significant cost savings. Preventing one HIV infection can save the healthcare system approximately $554,000 of lifetime medical expenses. In June, there was a federal rollback of HIV prevention strategies. In June of 2025, the U.S. Supreme Court's decision in Kennedy versus Braidwood gave the Secretary of Health and Human Services authority to reject preventative care recommendations, putting future PrEP coverage at risk. And federal guidance currently prohibits prior authorization for PrEP, but these protections can be reversed. And Vermont cannot rely on unstable federal policy to protect access to life-saving HIV prevention. Barriers such as cost sharing, prior authorization, and limited prescribing access continue to delay or prevent care for people at risk of HIV. So what does our amendment do? This third instance of amendment has to do with these HIV prevention drugs. Here we struck out section 10, we added a new section 10, and then we changed the effective date section to section 11. In this new section 10, we start with defining HIV prevention drugs, which I just did, PrEP and PEP, or PEP and PrEP, and supportive health service. We then added that coverage be required by any health insurance plan and Medicaid without any deductible, coinsurance, copay, or other cost-sharing requirement, except if it would disqualify a high deductible health plan from eligibility for an HSA. We want everyone to have access to these life-saving prevention drugs. And we also require coverage by all healthcare professionals issuing the prescription for any HIV prevention drug for which Medicaid does not require prior authorization, as long as the healthcare professional is acting within their scope of practice and is enrolled as a participating provider in Vermont Medicaid. So that is the bill and that is the amendment. And we heard from many, many people. I'll name a few of them, not by name, but by organization. Office of Legislative Counsel, the social worker of Washington County Mental Health Services, Vermont Legal Aid, DEVA, of course, Agency of Human Services, Bi-State Primary Care, Compass Pathways, HIV and HCV Resource Center, Vermont Pharmacists Association, Blue Cross Blue Shield, and OPR. And the vote in your Health and Welfare Committee was 5-0-0, and we asked if the Senate concurred. Thank you, Mr. President.
Recognize the senator from Chittenden Southeast, Senator Lyons, for the report of the Committee on Appropriations.
Thank you, Mr. President. Senate Appropriations reviewed the bill and found that there is a de minimis effect on the appropriations to the state. Thank you, Mr. President. The vote was 7-0-0.
The question is, shall the Senate propose to the House to amend the bill as recommended by the Committee on Health and Welfare? Are you ready for the question? If so, all in favor, say aye. Aye. All opposed, nay. The ayes have it. You've proposed to the House to amend the bill as proposed by the Committee on Health and Welfare. The question now is, shall the bill be read a third time? Are you ready for the question? If so, all in favor, say aye. Aye. All opposed, nay. Ayes have it, and you've ordered third reading of H611. That brings us, ooh, that's a handful. We have on the calendar for action H657, which was passed by the House on May 8th of 2026. Was referred to the Committee on Health and Welfare, which reports it has considered the bill and recommends that the Senate propose to the House that the bill be amended as it appears starting on page 2704 of today's calendar, and that with such proposal of amendment, the bill ought to pass. Affecting the revenues of the state, the bill was referred to the Committee on Finance, which recommends that the bill ought to pass in concurrence with proposal of amendment as recommended by the Committee on Health and Welfare. Listen to the second reading of the bill.
H657, an act relating to enabling unaccompanied homeless youth to obtain certain services without parental consent.
Recognize the senator from Orleans, Senator Morley, for the report of the Committee on Health and Welfare.
Thank you, Mr. President. There's two things I can promise you about this bill right now. A, as I'm not an expert in all these fields, probably not even one, and this is going to take a little bit. So you may want to sit down. Section 1 of the bill looks at reach up and limiting or getting rid of the asset test. And I'm sure I'll get more questions about that later. You can see it was $9,000, and that has now been lifted in the department underneath that section. The department shall not impose an asset limit for the purpose of initial and continuing eligibility for the reach up program. Section 2 are definitions for the Social Security benefits for youth in foster care. And then it goes through and just lists all the definitions. One that kind of intrigued me was number 5, the qualified ABLE account. I'd never heard of that before, so I ended up looking it up. And the ABLE account is for savings accounts for people with disabilities, which you're going to hear about later on in this bill. Section 3, foster care Social Security benefits. I want to talk about this because there was a lot of discussion in this. Most states right now allow people, individuals in foster care to receive their benefits from Social Security. Right now, the state of Vermont's not doing that. And what happens is those individuals that are in foster care, and there's around 80 of them right now, it goes and DCF takes the money and offsets their budget with those dollars. And so that was a big deal. It's been discussed a lot. And this bill would look at removing that so that those children actually get that money so that when they leave foster care, they actually have some money for transportation, which is a big issue for young individuals and the like. Then you have A and B. A, the department shall not use any portion of the child's Social Security benefits to offset the state's costs. I just mentioned that. And upon the request of the child or the child's foster care provider, the department in its capacity as representative payee for a child may use the child's Social Security benefits for the child's unmet needs beyond the amount that the state is obligated. Under C, in its capacity as a representative payee for a child, and with the assistance of the state treasurer, the department shall establish a trust account for the child, which shall be a qualified ABLE account, as I just identified, for the child receiving SSI benefits. 2, monitor any federal asset or resource limits for the child's SSI benefits. 3, ensure that the child's best interests are served by using the child's Social Security benefits for the child's unmet needs or conserving the child's Social Security benefits in a way that avoids violating any federal assets or resource limits. 4, I'm going to move on to 5, that they need to provide an annual accounting of this use and application for these benefits for the child's parent, legal guardian, or counsel. Section 4, unaccompanied youth, another big issue. And I actually refer to this bill as the DCF omnibus bill because there's a lot happening in this bill and it's all basically pertaining to DCF. The legislative intent in instances in which severe family dysfunction, such as abuse, neglect, child abandonment, or lack of financial support has left a youth who is 16 or 17 years of age homeless, and other supports such as foster care are deemed inappropriate. It is the intent of this General Assembly to provide an unoccupied youth, unaccompanied youth with the resources necessary to obtain services and benefits that the unaccompanied youth's peers can obtain with the consent of a parent or a guardian. Section B are definitions. And it goes through and just defines homeless child or youth, and then under that, there's AB all the way down to G. Under 2, school district homeless liaison. Number 3 is unaccompanied youth, what it means. Then under C, the certification. This is a big one too. An unaccompanied youth may become certified if the youth is found by a school district homeless liaison or the appropriate staff person to be an unaccompanied youth. 2, believed to qualify as an unaccompanied youth by A, the director of emergency shelter program, B, the director of a runaway homeless youth program, C, a continuum of care lead agency. I had to look that one up too, and that they play a crucial role in addressing homelessness. They provide oversight and coordination. They perform an assessment referral, funding and resources, and community engagement. The Chief Juvenile Defender, and E, the Vermont Network Against Domestic and Sexual Violence. D, proof of certification. The department shall contract with a community organization that serves homeless and runaway youth in Vermont to develop a standardized form that shall be used by the entities specified in subsection C of this section. And then it talks about what's going to be on the front and the back of that form. B, the department shall post a certification form and information about the section on its website, including who's eligible for certification, and which individuals and entities can complete the certification from forms pursuant to this section. 2, without the consent of a parent or guardian, certified unaccompanied youth may use the completed form to, there's quite a few things here, apply at no charge for a non-driver identification card, a learner's permit, operator's license or operator's privilege card. B, obtain a vital event certificate at no charge. Consent to care by healthcare professionals licensed or certified in Vermont. D, enter into a contract for housing. E, obtain employment. F, purchase an automobile and obtain an automobile liability policy. G, apply for a student loan. H, obtain admission to high school or post-secondary school. I, open an account at a state or federally chartered bank or credit union. J, receive services for victims of domestic or sexual violence as appropriate. And K, participate in a court diversion program. Moving on, E, use of certification form. A healthcare professional shall accept the completed form as proof of the youth's status as a certified unaccompanied youth. F, consent of a parent or guardian. This section shall authorize an accompanied youth to obtain benefits and services listed in subsection D of this section, which we just went through. A person, provider, or healthcare professional shall not require the consent of a parent or guardian as a condition providing a benefit or service authorized under subsection D of this section. 2, the Commissioner of Financial Regulation shall ensure that minimum youth certification requirements are met for the purpose of making it legally permissible for a bank, credit union, or insurance company to contract with an unaccompanied youth. G, immunity for liability, and this is important. Any entity, provider, or healthcare professional who relies in good faith on a certification form presented by a person who claims to be a certified unaccompanied youth pursuant to this section shall be immune from liability for such reliance unless the entity, provider, or healthcare professional acted with gross negligence. H, applicability of compact. I had to look that one up too. Nothing in this section shall be construed as altering the interstate compact for juveniles. And basically, they created it, federal law in 1955. And it's a framework to address the safety needs of juveniles in interstate movement. Section 4A, unlawful sheltering, aiding a runaway child. What you're going to find here under number 3, you're going to see a person providing assistance pursuant to 33 VSA section 4908. And that's what we just went through. That was section 4 of this bill. So you're going to hear me referencing back to 33 VSA 4908. And it's updating a lot of existing law is what's going on in certain sections. As an example, under section 5, if you go down to number 3, B3, says an unaccompanied youth who has obtained a certification pursuant to 33 VSA 4908, and that's dealing with fees for copies. You're going to see the same thing as section 6, non-driver identification cards, where we down under 3C, once again, no 33 VSA 4908. Section 7, under fees, same thing. Under E1, an unaccompanied youth who has obtained a certification pursuant to 33 VSA 4908 shall be provided with operator's licenses or operator privilege cards at no charge. Number 2, E2, no additional fee shall be due for a motorcycle endorsement for any unaccompanied youth who has obtained a certification pursuant to, you guessed it, 33 VSA 4908. Section 8 is doing the exact same thing, which is the learner's permit. And under 2, under that section, motorcycle endorsement, also 33 VSA 4908, motorcycle learner's permit, same thing. Also, obtain a certification pursuant, an unaccompanied youth who has obtained a certification pursuant to 33 4908, an applicant under 23 years of age who was in care and custody of the Commissioner for Children and Families pursuant to 33 VSA 4903 in Vermont after attaining 14 years of age shall not be charged a fee for a learner's permit or a duplicate or renewal thereof. Moving on to section 9, transportation of children. Under A1, you're going to see least restrictive, which has the same meaning as in section 5130 of this chapter. You're going to see that under section 12. So I just kind of explained one thing, and now this is going to the section 12 of this bill as well. So you'll see number 1 meaning as section 5130, 2's 5130, 3's 5130. So you can also see those definitions on 5130 in section 12. And then we discussed secure transport, soft restraint, waist shackles. And under B of this section, the Commissioner of Children and Families shall ensure that all reasonable and appropriate measures consistent with public safety are made to transport or escort a child subject to this chapter in a manner that it was saying reasonably avoids physical and psychological trauma. We struck reasonably avoids and put in prevents physical and psychological trauma. The Commissioner for Children and Families shall have the authority to designate the professional or law enforcement officers transporting children and shall authorize the method of transport. A contract for transportation services shall include requirements in this section. Transportation services with non-contracted law enforcement officers shall only be authorized in emergency situations or by court order. The Commissioner shall provide education materials complying with this section that outline the legal requirements for the secure transportation of children to individuals designated pursuant to subsection C of this section, and shall obtain verification that all designated individuals have reviewed the educational materials. So there's a lot going on here, making sure that when you're transporting youth, that it's really, really well looked into. And under E, secure transport shall only be used when the department determines and documents why it is necessary to prevent the risk of serious physical harm to the child or others based upon the individualized risk. What I've also learned going through this was Transporting adults is one thing, there's rules and regulations around that. Children really didn't have anything, and so this bill is looking to put into statute protections for children being transported. F, soft restraint shall be the first option for restraint, and other mechanical restraint shall not be utilized as a substitute for soft restraints if the soft restraints are deemed adequate for safety. G, an entity contracted pursuant to subsection C of this section shall provide documentation to the department for the use of restraints when, 1, the entity believes the risk of serious physical harm to the child or others requires the use of soft restraints before or during the transport, including a description as to why less restrictive interventions could not reasonably be attempted or why the attempted use of less restrictive interventions was unsuccessful. 2, the entity believes that the risk of serious physical harm to the child or others was such that soft restraints were not adequate for safety. 3, the use of weight shackles was determined to be the sole means of preventing serious physical harm to the child or others. H, documentation for the use of restraint shall be completed prior to transport unless the circumstances that require their use occurred during the course of the transport. I, the use of weight shackles shall be prohibited on children 12 years of age or younger. The use of weight shackles on children 13 years age or older shall be assessed and determined to be the sole means of preventing serious physical harm to the child or others and documented accordingly. Only designated law enforcement agencies shall use the weight shackles on a child transported pursuant to this section. We're gaining, just so everyone knows. J, the commissioner shall ensure supervisory review by the department of all documentation required by this section. K1, annually on or before January 15th, the DCF shall submit a written report to the House Committee on Human Services, the Senate Committee on Health and Welfare, the Office of Child, Youth, and Family Advocate, addressing the number of secure transports of children during the previous year, including for those transported with restraints. We heard a lot of testimony on, there wasn't great data on really understanding how many transports were done, and I felt comfortable. They have a pretty good handle on it, but in what capacity, age, and all of that. So we're going to be looking to get more and more information from them, as you're going to see through A through F for transported with restraints. 2, once the department has upgraded its technological capacity in a manner that enables it to collect responsive data, information specific to these subdivisions of this subsection shall be collected and included in the annual report with regard to all secure transports. Annually on or before January 15th, the Department of State's attorneys and sheriffs shall submit a written report to the House Committee on Human Services, Senate Committee on Health and Welfare, DCF, the Office of Child, Youth, and Family Advocate, addressing the number of court-ordered transports of minors conducted by the state, transport duties pursuant to 24 VSA. They shall include 1, the date of birth of transported minors, whether restraint was used during transport, 3, if restraint was used and the type of restraint that was used, whether the minor's case was a delinquency, youthful offender, or criminal proceeding. And 5, the purpose of the transport, which is fairly obvious in my mind. Section 10, report restraint and transportation of children. On or before December 15, 2027, DCF shall submit a written report to the House Committee on Human Services, Committee on Health and Welfare, addressing how the department is effectuating the policies set forth in 33 VSA, including contracting with law enforcement or private agencies for the transport of children, departmental oversight and supervisory review of the secure transport of children, including transport provided by private agencies or law enforcement officers. 3, the mechanism used by the department to collect and review data on the application of mechanical restraints during the transport of children in compliance with 33 VSA. 4, materials and requirements for designated contractors. 5, written policies used to effectuate the law. 6, other information the department deems relevant. Section 11, the use of force policy. the Vermont Criminal Justice Council, in consultation with the Department of Vermont State's Attorneys and Sheriffs, the Office of the Child, Youth, and Family Advocate, Disability Rights Vermont, Department for Children, Families, and of Disabilities, Aging, and Independent Living shall conduct a formal review to determine whether its use of the force policy should include an appendix to adequately address the transportation by law enforcement of children under 18 years of age. That is in alignment with the public policy considered for the transport of children in custody of DCF. Section 12, non-transport related restraint and seclusion. And seclusion is a big deal on younger individuals when they're taken into a room and secluded for a period of time. It really, we heard testimony, really can be impactful on those young individuals. So 5130A as used in this section, and those were some of the ones I discussed earlier on 5130, so that's where those definitions come from. I'm going to move over to restraint, secure residential. Okay, DB, the department shall not use or authorize the use of prone restraints, mechanical restraints, chemical restraints, or strip searches on a child, which was just defined. C, seclusion or physical restraint shall not be used for punishment, disciplinary purposes, the protection of property, or any other reason other than as a safety measure of last resort, prevent a serious and immediate risk of harm to the child or others. D, a staff member shall use other less restrictive interventions unless less restrictive interventions have failed or would be ineffective in stopping imminent danger of physical injury or property damage. C, after attempting to use less restrictive interventions, a staff member trained in accordance with this rule may physically restrain a child or place a child in seclusion if the staff member, this is important, 1, determines that the child's behavior poses a serious and immediate risk of physical harm to the child or others. 2, conducts the physical restraint or seclusion in a manner that respects the child's privacy and limits physical and psychological trauma. 3, after initiation of the intervention, explains to the child the reasons for the physical restraint or seclusion and informs the child of circumstances that allow release from physical restraint or seclusion. F, if a child is placed in the physical restraint or seclusion pursuant to subsection E of this section, the child shall be released immediately when there is no longer a serious immediate risk of physical harm to the child or others. G, restraint or seclusion lasting more than 10 minutes shall require supervisory approval and oversight. Restraint or seclusion lasting more than 30 minutes shall require clinical and administrative consultation, approval, and oversight. A child shall not be held for more than 1 hour in restraint or seclusion without an in-person assessment by a clinician and authorized by the administrator on duty. So I just want to stop there for a minute and say that we heard some testimony that I considered reporting on, but after giving it some deference and thinking about it over the weekend, I decided not to. It was too intense, and I'm not going to talk about it, but it was about a young girl and some of the situations that she had to endure and go through. And this bill is going to help protect. So it meant a lot, and it really had an impact on me as well. It did other committee members as well, but I'm not going to mention that. 2, a child in seclusion shall be provided constant uninterrupted supervision by a qualified staff member employed by the program who is familiar to the child. H, nothing in this section shall be construed to include a locked bedroom during regular sleeping hours in a secure residence or seclusion, or to conflict with any law providing greater or additional protections to minors. I, notice of the use of restraint or seclusion on a child in the department's custody shall be provided to the department, the child's parent or guardian, the child's guardian ad litem, and the child's attorney, if applicable, within 24 hours. And I'm not a lawyer like our Secretary of the Senate, so I had to look up ad litem. And that actually means a court-appointed individual who represents the best interests of a child. J, the program or staff member using seclusion or restraint shall document its use and provide a copy of each recorded use of seclusion or restraint, including a copy of any audio or visual recording to the commissioner. Upon request, the audio or video shall be provided through secure means of transmission and shall include blurring to protect the identity of any child in the program who are not in custody of the department. K, the department shall collect the following data on the use of seclusion and physical restraint by placement type, the program name, the age, gender, and the racial background of the child. Okay, the specific types of the seclusion or physical restraint used. 2, the length of time a child was secluded or physically restrained as applicable. L1, prior to contracting with any program for the child of the care in the department's custody, the department shall conduct a review of any records from the prior 5 years regarding the safety of children in the program's care, including any violations of the program's licensing status and any resulting remediation. 2, the department shall remove any Vermont child from risk of harm and shall initiate a search for alternative providers if an out-of-state residential provider is determined to be in a violation of the standards in the contract regarding restraint, seclusion, or violation of the state's licensing entity. So some children aren't just taken care of here in the state of Vermont, but there are also other states that provide some services for our children. M, notwithstanding subsection B of this section, a child detained in a secure residential program may be restrained with mechanical restraints for a momentary initial hold to enable relocation of a child to a less restrictive method of intervention if necessitated to prevent serious and immediate harm to the child or others. Except that under no circumstances shall a garment adjacent to the child's body that restricts freedom or movement or immobilizes or reduces the ability of a child to move that child's arms, legs, body, or head freely be utilized. The procedure and standards established under this section, including notice and reporting requirements, shall apply. Under A, notwithstanding subsection B of this section, a child detained in a secure residential program may be subjected to a strip search if a pat search has led to a probable cause to believe that the child has possession of contraband that poses a threat or serious bodily harm to the child or others, and the child has refused to voluntarily turn over the contraband. O, the department shall post on the family's division scorecard or another prominent location on its website the rates of restraint and seclusion used on children in licensed programs and the number of uses of secure transport and restraint used during transport. The department shall update the information at least annually. So it's important that we continue to look at the data, develop it, see what's happening to the children. P, the department shall develop and adopt rules in collaboration with the Office of the Child, Youth, and Family Advocate and in consultation with stakeholders implementing this section, including requirements for staff training, standards for supervisory oversight, record keeping, and reporting by residential programs, oversight responsibilities of the department, and any other necessary standards. Section 13, I'm going to go down to down to 2. When contracting with an out-of-state program, the department shall include a requirement that the program adhere to the provisions of this section. There was some discussion on whether or not all of our existing facilities out of state could do this, were willing to do this, and the costs associated with it. And so we're going to do it. I think they've reached out to them. I'm hopeful that the cost won't skyrocket on because of that going forward. Section 14, report children in correctional facilities. On or before January 1, 2027, departments for DCF shall submit a written report to the House Committees on Human Services, Corrections, Institutions, the Senate Committees on Health and Welfare and on Institutions regarding the use of restraint and seclusion on minors detained in Department of Corrections facilities and potential means for reducing physical and psychological trauma from restraint and seclusion. Preparing the required report, the department shall consult with a work group composed of the office, and it lists all of them, which you folks can read. B, members of the work group who are not participating in a professional capacity shall be entitled to their per diem compensation. And you'll hear on that amendment, I imagine, from appropriations later. Section 15, proposal to extend supports for children over 17 years of age. And this basically, it's listing out November 1, 2026, DCF shall submit a written report in consultation with the judicial branch to the House Committee on Human Services, Senate Committee on Health and Welfare, and recommendations for court oversight processes that meet federal requirements to allow access to federal funds for programs that may support youth up to 21 years of age and that ensure sustainable use of judicial resources. Then the report shall include recommendations to the legislature for action. Section 16, prenatal engagement and family support working group. Creation, there is created the prenatal engagement and family support working group to examine the Department of Children and Families' current practice of using a pregnancy calendar to monitor and track certain pregnant individuals in Vermont and provide recommendations on alternatives to a pregnancy calendar and ways to support pregnant individuals in need of services. B, membership. The working group shall be composed of the following members. And you have Department Commissioner of Family Services Division of DCF, Vermont Child, Youth and Family Advocate or designee, Executive Director of Vermont Family Network, designee, Executive Director of Legal Aid or designee, the President of Planned Parenthood or Northern New England or designee. Then on the next, it continues down and lists a whole bunch more. And then under C, the powers and duties, the working group shall study the Department for Children and Families' current practice of using pregnancy calendar to monitor and track certain pregnant individuals in Vermont and provide recommendations, alternatives to a pregnancy calendar, and ways to support pregnant individuals in need of services. Then there's the assistance on D for the purpose of scheduling meetings, providing administrative assistance. E, the report. F, the meetings. Then one, the Vermont Child and Youth Family Advocate or designee shall call the first meeting. The working group shall select a chair among its members in the first meeting. 3, a majority of the membership shall constitute a quorum. The working group shall cease to exist on February 1, 2027. Compensation and reimbursement. Members of the working group who are not otherwise compensated for attendance at meeting shall be entitled to per diem compensation under 32 VSA 1010. I've heard that statute quite a bit. So, number 2, members of the working group who are not participating in their professional capacity shall be entitled to per diem compensation. Same thing. These payments shall be made from monies appropriated to the Department of Children and Families. I want to talk a little bit about that section. I guess it was discovered a while ago about the pregnancy calendar, which I didn't really know anything about. So I started looking into it a little bit more, and it's a tough situation. It is going on. Everyone knows it's going on, and this study group's going to take a look at the best ways to work with those individuals that may need some additional help. Vermont's pregnancy calendar is a tool used by DCF to monitor pregnancies deemed high risk. This calendar tracks certain pregnant individuals, including their expected due dates and other identifying information to assess potential risk related to parenting suitability. And so there's been, over the years, I think there's actually an article in the paper December or January on this issue as well. So hopefully this report and this group will be able to get together and help us move forward. We heard I'm not done. Section 17, the effective dates, the section, in section 10, section 11, 14, 15 shall take effect on passage. B, section 9 and section 12 shall take effect on January 1, 2027. C, section 2 and 3 shall take effect on July 1, 2027. D, sections 13 shall take effect on July 1, 2028. And E, all remaining sections shall take effect on July 1, 2026. And there's an amendment later that I'll be talking about the effective dates as well. The committee vote was 5-0 on this, and some of the people we heard from in testimony was the Joint Fiscal Office, the Office of Legislative Counsel, the bill sponsor, the DCF, Office of Child, Youth and Family Advocate, Vermont Youth Council, Youth Advocate, Voices for Vermont's Children, Spectrum Youth and Family Services, Vermont Family Alliance, Attorney General's Office, Department of State's Attorneys and Sheriffs, Vermont Sheriff's Association, Department of Mental Health. So those are the individuals that testified, or organizations that testified on behalf of this bill, and I hope that the Senate concurs with this bill. Thank you.
Senator wasn't kidding when he said it was going to be a long report. Senator from Chittenden for the report of the Committee on Finance.
Thank you, Mr. President. Your Senate Finance Committee reviewed this bill and found 6 sections with de minimis impacts on state revenues, 2 with material impact, and 1 with unknown impact. Section 1 is the one with material impact on fiscal year 2027. This would eliminate the asset limits for families, asset limits, not income thresholds, for the purposes of determining initial and continuing eligibility for the Reach Up program. Currently, the asset limit is about $9,000. Current law excludes certain types of assets, including VHEIP plans, IRAs, 403Bs, and so on. According to DCF, the fiscal impact is difficult to determine, as eliminating the asset limit could potentially expand the program by qualifying an unknown additional number of individuals. But looking at fiscal year 2025, there were a total of 18 cases where people were denied because their assets, not their income levels still met the requirements, but their assets were over that resource limit. And that can be for a variety of reasons, as I've heard in the hallways and when we heard about the bill. If they're saving up for a down payment, if they're saving up for what you need to secure an apartment, or also just to have a certain amount of resources on hand, it's sometimes necessary. So that would be, the average cost per case would be about $646, using the fiscal year 2025 as a proxy. Based on that, the 18 cases that were denied, the fiscal impact removing these asset limits could be as much as $140,000 in fiscal year 2027. Section 3 has revenue impacts and appropriations impacts for years out, not this fiscal year. So this would prohibit DCF from using any portion of a child's Social Security benefits to offset the state's cost for child's maintenance. My understanding is this is in response to a directive from the feds, and so it's just aligning, and you're going to hear more about this in an amendment momentarily, if I'm not mistaken. So they can you can't use it for child's maintenance except to maintain a child's eligibility for supplemental Social Security income benefits and to avoid a violation of federal assets or resource limits. Currently, DCF uses this money to cover the cost of care for youth in custody. Since the section would not take effect until July 1, 2027, which again, I think you'll hear more about that in the amendment, it would not impact this fiscal year. However, it would have an approximately years out $700,000 impact in fiscal year 2028 or further. The sections 5 and 6 had de minimis impact. It's waiving a $10 fee for copies of vital event certificates, birth, death, marriage, civil unions, and so on. Similarly, sections 7 and 8 also de minimis. That's waiving driver's license and permit fees and motor license fees for unaccompanied youth. Section 12 and 13 has an unknown potential impact on future budgets. These additional standards that you just heard so eloquently in an enthralling floor report that we're on a very sensitive topic that I think we all have a great deal of sympathies for. As we apply more restraint and seclusion restrictions on our out-of-state providers, it could force renegotiations for more expensive contracts, but JFO is unable to estimate the potential impacts of that in years out. Section 14, again, de minimis, just the working group, so nothing to expand upon there. And also with the prenatal engagement and family supporting work support work group, there was de minimis impact on state revenues. Your vote in Senate Finance was 6-0-1 to support the bill as it was presented to us, and we encourage the Senate to concur. Thank you, Mr. President.
I recognize the senator from Chittenden, Senator Lyons, for an amendment.
I'll yield to the senator from Orleans. Thank you.
The senator from Orleans for an amendment.
Yes, there are 2 amendments. The first one in section 333 BSA in subdivision C1, all it's doing is striking out the word "a trust account" and making it an account. The treasurer didn't like the word trust account, and it really didn't fit what we were trying to do as defined. So we're eliminating trust account and putting in account. The second amendment, section 2, section 3, and section 13 shall take effect on July 1, 2028. And D, all remaining sections shall take effect on July 1, 2026. And what this, we heard testimony from DCF that pushing out this date would help them implement this legislation. Obviously, there's a lot going on here. And so that's what that Amendment 2 does. Thank you, Mr. President.
The question is, shall the recommendation of proposal of amendment of the Committee on Health and Welfare be amended as moved by the senator from Orleans? Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay. The ayes have it, and you have further amended the recommendation of proposal amendment of the Committee on Health and Welfare. The question now is, shall the Senate propose to the House to amend the bill as recommended by the Committee on Health and Welfare as amended? Are you ready for the question? Senator from Chittenden.
Thank you, Mr. President. I know it was a long report, and it has a tendency for us to glaze over when we listen to reports like this. But I'd like to remind us of the importance of the bill that we're looking at. It was just a few years ago when we were reading about abuse of a child in one of our facilities in the state. We were also reading about and hearing about the death of an infant due to abuse and neglect. And we have come a long way. One of the things that we did a few years ago was establish the Vermont Child, Youth, and Family Advocate Office, who worked very closely with the Department of Children and Families and other organizations that support children in our state. This is a really important bill. It continues important work. I hope we're not immune to the importance of this, and that we do not forget the reason that began all of the work that underlies a bill like this. So, Mr. President, I ask for your support on the bill as presented. Thank you.
Senator from Windsor.
Thank you, Mr. President. I rise fully in support of 657, but I do have a question related to a section, and I would ask to inquire of the presenter.
The reporter's interrogated.
Thank you, Mr. President. And let me start by saying I appreciate your coverage of this difficult and disturbing topic with real empathy and decorum. So thank you very much for that. I have one question, and it comes from a constituent, and that's related to the non-transportation related restraint and seclusion section 12. It was brought to our attention on the Windsor delegation that there has been the use of a space, and I don't know what the correct terminology is, but the constituent referred to it as a rubber room, which is I believe, a padded windowless space within either DCF office complexes or in a place where a child would receive protective services. And this constituent was extremely disturbed by the use of these facilities. And I just want to understand how this bill would cover that and if you discuss the topic.
Mr. President, I apologize. We did receive testimony on seclusion. I don't remember hearing or reading about anything dealing with a rubber room in the state of Vermont.
Okay.
So I apologize. I can try to look into it more. Sounds like you know more about it than me, Mr. President.
Yes, we would like to hear more about this. The constituent was concerned and had images that they provided to us that they felt should be addressed. And I believe, based on the bill that you have proposed, that it would cover any kind of specialized space, but it would be nice before third reading to just get confirmation that there's not a separate designation for a different kind of location for that child. So I will inquire of the presenter no further and thank them for their floor report.
Question is, shall the Senator from Windsor.
Thank you, Mr. President. I'd like to thank the senator for a terrific report, albeit disturbing. I would just also like to comment that when we know we're hearing drum beats out on the front lawn, spring really has arrived. I would like to know, you talked about data, and I appreciate whatever data is being brought to bear on this subject, but the number of times you use the word shackled just had me just, deeply concerned, and so,
Senator, would you like to inquire of
yes, I
someone?
would very much like to inquire.
The
of
reporter of the bill is
Thank
interrogated, and Senator, I would ask you to not use the word "you" because it sounds like you're directing it at the senator,
I am, but I won't.
which is a violation of the rules.
I live to violate the rules. What can I tell you? I apologize. I would like to ask the senator if we collect data on the number of times shackles are used on our Vermont youth and a year, and if we do, is that going up or down? We didn't really hear the context of some of the issues that we're addressing, whether we're doing better, whether we're doing worse. I mean, we can always do better. So I would just, my inquiry, I guess, is on, do we collect data on the number of times shackles are actually used on Vermont youth a year?
There is some data, Mr. President, and it is disturbing, in my opinion. And I think we're just getting more and more data. And after this report, after this bill passes, you're going to receive even more data. But it has been on the rise.
That's even more disturbing. Is there an effort to, so we are tracking the amount of shackle use in our youth per year? It's on the rise. You have any notion?
That's
how on the rise?
exactly, Mr. President, what we want to delve into with some of these reports and get more information on. Okay. I do have some testimonial material that I could provide to the senator that will give her some of that information.
Right. Thank you very much. I used you, but I thank the senator very much.
Very good, Senator. Are you ready for the question? The question is, shall the Senate propose to the House to amend the bill as recommended by the Committee on Health and Welfare as amended? Are you ready for the question? If so, all in favor say aye. Aye. All opposed, no. The ayes have it, and you've proposed to the House to amend the bill as recommended by the Committee on Health and Welfare as amended. The question now is, shall the bill be read a third time? Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay. Ayes have it, and you've ordered third reading of H 657. We are passing over the next couple and going on to H 778.
Point of inquiry.
What is your point of inquiry?
I respectfully request that the presiding officer list the bills that they're passing over. It's become difficult throughout today's floor to catch which ones. So I'm wondering if the presiding officer could please list which bills they are passing over.
We are passing over S202 and S223. House proposal of amendment to the Senate proposal of amendment. The House has considered the Senate proposal of amendment to H 778 and has concurred therein with a further proposal of amendment. The question is, shall the Senate concur in the House proposal of amendment to the Senate proposal of amendment? Senator from Washington.
Thank you, Mr. President. I would request a 30-second recess to meet with the members of the Senate Natural Resources and Energy Committee over in this corner.
We'll take a brief recess. Senate please come to order?
Okay.
Count for 13.
Senator from Washington.
Thank you, Mr. President. Senate Natural Resources and Energy did take a look at the recommendation from the other body, and it is a very simple change. They are just, their amendment changes one word with a phrase, a whole community that would be inundated if a dam were to fail. It changes that to the whole community that would be affected if the dam were to fail, and it's about the pilot coordinating and collecting input from those in that community. So seemed like a very straightforward change to us. It's more inclusive, and so on a recommendation of 302, we ask the Senate to concur.
Question is, shall the Senate concur in the House proposal of amendment to the Senate proposal of amendment? Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay. The ayes have it, and the Senate has concurred in the House proposal of amendment to the Senate proposal of amendment. That completes the orders of the day. Senator from Chittenden.
Thank you, Mr. President. Before I make an adjournment motion, I just would like to remind senators of a couple of procedural things. Again, as we come into the end game, the calendar fills up, things are moving quickly, chairs are trying to balance lots of things at once. I understand all of that. With that said, people do have a right, when they look at the Senate calendar and they see that something is up for action, that barring some strange circumstance, it will come up for action in a predictable order. So today, we did good work, but we passed over nearly half of the items on the calendar. So I would just ask chairs, along with senators generally, please check the calendar for what's on action that day. If you have a bill, the idea is you're going to report it when it comes up for action. Now granted, in terms of a House proposal of amendment, you need maybe a longer committee time to decide how to respond to that. Perfectly fine to ask that it be passed over for a day in order to do that. What I would like to avoid is passing over a bill because you just didn't get to it. I suppose my advice would be short and to the point. Please get to it. Make sure you are ready when your bill comes up for action. The other thing that I would say is the procedure, if a bill is going to be passed over, is that you come to the pro tem, you explain the reason why, and we talk about it. I note it, I create a little list, and then I go to the lieutenant governor and the secretary, and we work all of that out. So the senator from Windsor had a good point. It's difficult if we're adding bills that we're passing over as we're doing them, because people are planning to report based on where the bill appears, and then people watching at home are tuning in, trying to see the action. So again, please check the calendar, be ready as a rule, and if you have an exception to the rule, come to me with it. I will then go to the secretary and the lieutenant governor. With that said, Mr. President, I would move that pending announcements, Senate stand in adjournment until 10 a.m. Wednesday, May 13th, 2026.
And I would add on one more thing to what the pro tem said, and that is we take a lot of recesses for bills in the Senate proposals of amendment, that if you look at the calendar, we'll have better flow because you can check and do your straw poll ahead of time so that we can keep it rolling once we're going. Are there any announcements? Senator from Washington.
Thank you, Mr. President. Senate Finance will meet at 1:30.
Senator from Washington.
Senate Appropriations will meet at 1:30.
Senator from Rutland.
Thank you, Mr. President. Senate Government Operations will meet at 2 o'clock.
Senator from Bennington.
Mr. President, the Education Committee will meet at 2.
Senator from Windham.
Thank you, Mr. President. Senate Institutions will meet at 1:30.
Are there any further announcements? Senator from Windsor.
Thank you. Just a reminder for Senate Economic Development, Housing and General Affairs will be meeting again this week at 8:30 every day. Thank you.
Are there any further announcements? Seeing none, the senator from Chittenden Central has moved that the Senate stand in adjournment until 10 a.m. Wednesday, May 13th of 2026. Are you ready for the question? If so, all in favor, say aye. Aye. All opposed, nay. The ayes have it, and we'll stand in adjournment till 10 a.m. Wednesday, May 13th,